Yo, how's it going, folks? Welcome to episode 154. Got it right first time. Hey, hope you're keeping well, folks. Haven't been here for a few weeks, been off. I've been busy with the Hemp Gardens project and Durham City Cannabis Club. I know this isn't really the format for it, but I'm going to give you an update anyway because, as the Simpa Life, we do sponsor and support DCC and their events. So the last event, the summer session, went really well. We had a great attendance. Police didn't bother us whatsoever. We didn't even get a call about our loud music. So I dare say this time, maybe we'll be cheeky. We might have a little bit louder. I'm not saying I want to force an interaction with our local constabulary, but I do like having that juxtaposition of them coming down to a group of several hundred stoners and telling us off about music. It really does give me a sense of the future that we can live in and work towards. And I think that's a good segue to jump into today's guest, who for the past, well, basically 20, 25 years has been working in some way to help make that a reality. So without further ado, I want to introduce you to today's guest, who I've been trying to get in the hot seat for a while now. I think the universe has aligned, and the synchronicity of all things has meant that today is the day, as we're going to discuss their new legalization campaign. I know I can hear you screaming. I'm going to discuss the legalization word. We'll figure that one out. But without further ado, let's jump into it. Today's guest is a writer, campaigner, a senior policy analyst at Transform Drug Policy Foundation, a committee member of Drug Science, and they formerly worked at the Medical Research Council and at Oxfam. They are Steve Rolls. How are you doing, man?
Pretty good. Good to see you at last.
At last, indeed, indeed. As I said in my preamble there, I think, or as we were talking about before we started recording, I think the universe was waiting for this campaign and for us to have this conversation. Because as I said to you, a lot of people have come to know me as the anti-legalizationist in a weird way. For all I'm pro obviously ending the war on drugs, I have a little bit of a bedbear, whatever the expression is, a slight problem with the language of legalization. So I'm very interested to have you in the hot seat today, Steve, to discuss this.
Brilliant. Let's go.
Excellent, excellent. All right, we will start. We'll start back at the start of all of this. So a good 20, 25 years ago, what first motivated you to get involved in drug policy and drug policy reform?
I mean, I kind of fell into it. It wasn't, I didn't kind of grow up like, people, I want to be a fireman or I want to be a, astronaut. I want to be a, drug legalizer. Um, I, 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 I was working at Oxfam campaigns office in Bristol. And around that time, a chap called Danny Kushlik, who had set up Transform a couple of years before in around 1996. As a, he'd been working in prisons with people who use drugs, supporting them, and he became very disillusioned with the policy and legal environment that had led those people down that road that had ended up with them in prison. And as part of his personal conviction, he felt that the drug laws needed reform. And as he kind of explored that, I mean, really, he should tell this story, but he basically came to the conclusion that we needed to end the war on drugs, end the criminalization of people who use drugs, and bring illegal drugs within a sort of legal regulatory system that would reduce the harms for people who use drugs and for the wider community that's impacted by the illegal drugs market. So he set up Transform, campaigned for a couple of years, eventually got some funding, and set up a funded organisation based in Bristol. And he was recruiting, and I went for the job because I was working in Oxfam, and brilliant as Oxfam is, it's a big, many thousands of staff. We were in a little regional office and didn't really have much autonomy. We were given our campaign materials from head office in Oxford. And my background was in development work, so I'd done a degree in geography and a master's in development and international relations. So I was interested in international politics and international relations, and development stuff, and that was why I was working at Oxfam. But this just seemed more exciting and more interesting, and it was an issue that I kind of developed my thoughts around because I'd been at university, I'd been witnessed the drug culture. I witnessed the good and bad sides of it, people having fun, people getting messed up, people getting arrested and prosecuted. So I had my own feelings about it, and I'd actually written some of my work looking at drug markets, both the development implications and the legal implications. So I had my own views of it, and I come to my own conclusions that we did need to end the war on drugs, and we did need to sort of move beyond prohibition. And it just, it just seemed like an interesting, more interesting than Oxfam. And Danny is a very exciting, charismatic person. And it just seemed like, it was quite, this is like in the late 90s. It was quite radical. It was one of those things that seemed intellectually very solid, but politically very sort of edgy and sort of marginal and quite radical. A lot less now, which I think is testimony to the way that the campaigning and that not just by Transform but by many organizations and individuals has progressed that public debate. But it was just really interesting and exciting, and so I applied for the job, and it was just a little effectively startup campaign group. And I've been there ever since, and things have changed a lot. The organization's developed, grown in its output, in its influence. The debate has kind of, maybe partly to do with us, but certainly a lot to do with lots of other people, has progressed enormously. We've moved from a kind of activism footing through more to consultancy. As legalization regulations started to happen, particularly with cannabis, we've moved from shouting at governments to working with governments, helping draft legislation. And because one of the things that we focused on was not just critiquing the war on drugs, but actually mapping out what a post-prohibition world would look like, the detail of how a regulatory system would work, not just for cannabis, but for all drugs. And we've produced very detailed policy papers and books and case studies and discussion documents, and we've engaged with governments, and we've engaged with the United Nations, and we've engaged with all kinds of professional bodies in medicine and law, and whole different areas. And yeah, it's been a really interesting journey, and we've got to this point where we are today, where the debate has real legs and is accelerating. Real world change is accelerating. So it's been a long time, but it does feel like we're winning. We've won the sort of public debate, and now we're beginning to move that support and experience into the political policymaking domain, where changes can happen and change is happening. So that's kind of how I got into it. And there were points when I almost bailed out and went and did something else, just before kind of around 2012, when it started to happen in Uruguay and Colorado and Washington with cannabis. I was kind of like, well, I've been doing this for more than 10 years now, having the same arguments. And, I've literally written a book on it, and I've literally had these same, and whilst it was interesting and fun, it can start to, doing the same thing again and again can start to drag in campaigning. But then it moved into this exciting new phase of actually, we got a call from the Uruguayan government saying, can you come to Uruguay, sit down with, all our ministers and our lawmakers and our politicians and our journalists and our doctors and everybody else, and start designing the policy for Uruguay. At which point it was like, oh, this is a bit more interesting. All the work we've done is kind of coming to fruition. So yeah, it's been a really interesting journey with cannabis, and, increasingly with other drugs as well, but maybe we can get into that.
Yeah, for sure. No, that was brilliant. That was concise. For people wanting to learn more about the formation of Transform, it's been a while. Actually, I didn't realize it was that long ago. We had Danny Kushlik on as episode 34, guys, a good few years ago now. I know Danny's obviously out of the game, but I definitely think we're probably worth another conversation with him at this point.
Yeah, definitely.
But yeah, I agree. He's very, very charismatic, very passionate. From the conversations I've had with him in the work, I've seen a natural born leader, and I can see exactly why Danny stepped away and why so many do, as you say. That, I mean, I've been in this space publicly shouting for 10 years. I mean, I'm not in policy or actual work. I'm just a guy on the ground doing what's in front of me, sort of thing. And I've seen so many of my contemporaries and peers burn out because of the gaslighting, the manipulation, just the bollocks. Like you say, you win the hearts and minds talking to people on the street. When you present the arguments, the data, the information, they understand it. They can still be like, oh, well, at the end of it, I wouldn't do that. And you're like, okay, you wouldn't. But there's 8 billion people, and a certain percentage of them definitely would. And they start to get it. But it depends on what drug, what area. I mean, we have a huge postcode lottery in this country, as you spoke of. You guys are sort of based in Bristol, very progressive when it comes to sort of drug policy, very progressive when it comes to youthful exuberance. So like right now, again, shout out, trying to get the crew on the podcast. Save Our Scene is down in Bristol, an amazing campaign group set up around live music, around like trying to legitimize the free party scene, which again became quite oppositional to the law and everything during the 1994 Free Party Act. And again, in that area, they're now able to just put on, oh, it's a 500-person rave and they've got a rig on the back of a van. You try that in another area of this country, you're shut down immediately. There's not a chance. Same with, as I said in the preamble, our Durham events, Durham police have basically said they trust me, not the organization that I run or work with, but me personally. And I think that's what the seeing with people like yourself and others is that that longevity gives them respectability. The continuity and consistency of the work means that the people who have that opinion of, druggies and drug supporters, it corrodes and erodes their ignorance over time. And they're like, oh, he's been here 10 years though. And he's
Yeah,
not,
I mean,
not trying to sell heroin to kids. Maybe we should listen to him. You know what I
I
mean?
mean, it's an interesting point. We've actually found that quite often with some of the local reforms that have happened, things like cannabis social clubs or drug testing at festivals, or some of the more progressive policing of when people are caught in possession, diversion programs and stuff. It's actually been the police, weirdly, who it might not weirdly, I mean, for some people it may seem strange, but the police have actually been the ones who have facilitated, enabled that, rather than the public health authorities.
Yeah.
And I think it's the more experienced police who are on the front line, and they see every day the futility and counterproductive nature of a sort of punitive enforcement, war on drugs type approach. They are the ones who have enabled some of the more interesting local reforms. And I know that the police are often seen as, the enemy or as a sort of hostile presence, and absolutely they can be. But I think it's important to be clear that there's a range of views within the police, and there are much more pragmatic people within the police who want to see, they know that the war on drugs fuels crime and makes communities less safe. And fuels turf wars and fuels organized crime activity, which has impacts on everybody, whether or not they use cannabis or other drugs. So we're getting into the detail already here, but it is quite interesting to me that in the UK, at least, often, particularly at a local level, it's been some of the more pragmatic police who've actually helped move things forward.
Yeah. For all several of the political parties in their manifesto, I think it was mainly just Tories and Reform, we're talking about sort of scrapping or updating, reforming the PCC system or the PCVC VC system we sort of have in some places. For people, that's police crime commissioners or police crime victim commissioners. These were political police, effectively elected by the local people. They were then given the authority to then
shape policing policy.
And as the PCC PCVC role, you were able to select your chief constable. So effectively that's what happened up here in Durham. Ron Hogg won the PCC chair, first one. You rest in peace, Ron. He would they then decided basically, I like this Mike guy. We'll stick with Mike, the current guy. They then basically had a conversation, Mike Barton and Ron Hogg, and they've discovered amongst themselves that, wait a minute, we can set policing policy in the county. If we set policy, our officers can't do shit. We don't need to wait for the politicians to tell us what to and to not enforce. All of the police across the 42, 43 constabularies, whatever it is, have the discretion for individual practice. Kind of similar to my international audience, like the townships or the states in the US. They don't set them in a de jure fashion, sorry. It's more de facto. So it's we choose as a collective to not do X or to do Y, rather than it being written into sort of local rules or laws. And I think
it enables them to do cool, progressive, sensible, pragmatic things. It can also, unfortunately, allow them to do stupid, punitive, posturing, populist nonsense. So it can, it swings both ways. I mean, but my feeling is that, having some of that power devolved to the local areas is a generally good thing. And in the context of drug policy reform, it has allowed some progress to be made despite Westminster.
Indeed, I think the pilot schemes
I mean,
is,
they can, but what they can do is there are limits to it. They can, like you say, they can do kind of de facto decriminalization. They can allow for certain harm reduction things which would be difficult otherwise, like drug testing, for example. But what they can't do is legalize and regulate, which may well bring us to the conversation on what the hell those terms mean. But maybe that you're in charge, boss.
I appreciate it. No, it's I want to stick with the cops thing for a sec, 'cause I think so. Ron and Mike started the first checkpoint diversion scheme up in Durham. I think it's been a minute since I've looked at this. You'll probably have the figures closer to hand. I think it's 9 checkpoint diversion schemes we got up to. Some in some constabularies, we weren't really expecting that to happen, but it wasn't really sort of de facto decriminalization. It was more, I guess, to use the same sort of language, a de facto deprioritization is how they termed it, because they didn't have the authority. It's the way, say, my events work in Durham. We do what we do based on the assumption, or on my assumption, that in order for me to get punished by the council, authority, the national state, whatever, it's the police that would do it. If I'm working with the police, then the police are not going to do it. So we don't necessarily have to liaise with all of the other agencies that are not going to get it. They're so compartmentalized and broken down. So like with the Hemp Gardens project we're working on, the council are supporting me. They just don't know they're supporting me. So the Civic Pride team gave me a load of litter pickers and bag rings and equipment. The then environmental team gave me a load of advice about committing a guerrilla gardening offence on private property. Like we've just spent Saturday, you can probably see the blister on me. Where's my camera? There you see a massive blister on my finger and my hands, of where we've just cut in a whole abandoned field and section. We cut all the hedges down. We've cut in 2 new entrances. We undug all the paths and we've put it back into common good. And so we're trying in this, because of the discretion that Ron and Mike gave us, even though we're under an entirely new system right now in the north. We've got a new MP, new council, new chief constable, and new PCC. Because of the legacy of what was done, it's very difficult for them to go fully back and erase it. Because in the discretion they created, like Mike and Ron somehow were able to get work done in Teesside. They were able to get work done in Northumbria. 2 neighbouring police forces had a certain discretion towards the ideas they were doing. So Ron and Mike were I'm gonna have to be careful of the language here. They weren't allowing, but they were helping in some way facilitate certain drug dealing and certain sex work. So when they found out about a certain couple of brothels in Middlesbrough, their policing strategy towards it adjusted compared to then street sex work. The same they did with then cannabis down there. They helped support Teesside Cannabis Club, even though they were under Cleveland Police. And so it just showed there is this. It permeates out from this position of this like ground zero of progression. And even though, like I said, everything has changed since, Teesside still operates. For Kush Tea's still there. I've been told I'm allowed to promote Kush Tea. I'm just not going to tell you anybody that's involved in it. So Kush Tea are obviously still operating in Hartlepool. That's like nearly 900 members. We still know there is discretion of some dealers, legacy intravenous drug dealers, that are effectively known but allowed to exist because the cops know they're not ticking on for violence and forcing their consumers into petty crime. They're not targeting vulnerable people. They're not, empire building. They are individuals quite often that are supplementing their own consumption with others that are already wanting access. They're not seeking to create a market. You know what I mean? So because once they start to recognize these things, the harm reduction naturally went through it. So then we started seeing things like dealers giving out harm reduction advice to their clients.
Right. So what you're effectively, I think one of the things you're talking about there is that the police can kind of do the sort of harm reduction that people are familiar with around use of drugs. The police can kind of do harm reduction around markets of drugs. So you kind of do supply harm reduction. Now we'll have to be clear that is within the context of an illegal market. Now, we would argue that legalization, regulation of drugs is a harm reduction move, but you take control of the whole market, right, and supply, and you regulate it in a responsible way to deliver the kind of health and community outcomes that we all want. Supply harm reduction is kind of managing the harms that are created by prohibition. So so like you say, you allow less problematic markets to exist, or you tolerate them because you know that if you get rid of them, you could potentially get a whole bunch of bad actors come in and take over. What you won't do is eliminate them altogether. You just displace or move it to make things worse. But I think the other point that's worth touching on that you sort of allude to is that if you look at almost any area of drug policy reform and debate, whether it's decriminalisation, whether it's harm reduction, whether it's cannabis reforms, whether it's the social clubs, or any of that stuff, it's all been led from the bottom up. Almost all of these things have been led by grassroots organisations, individual activists, non-government organisations, or in some cases local police or local authorities. What generally hasn't happened is that the leadership has come from the top. So we do not get leadership from Westminster. We do not get leadership on these things from the United Nations or from the European Union. It's almost always been a bottom up process. And the political risk and the political capital is spent at and people often get arrested setting up a sort of guerrilla supervised consumption service or a cannabis social club or an informal needle exchange or an informal safe supply where they test drugs and supply them to people who are injecting or something. And people and the cannabis social clubs in Spain, people are still getting put in prison for that. Even though they've been running there for more than 20 years now. So it's always a bottom-up process. But the important thing there is on every one of those things, whether it's decrim, whether it's cannabis reforms, whether it's harm reduction, needle exchanges, supervised consumption, we always win. We always win the arguments. You do the work, you provide the evidence, you provide the sort of visible benefits of these reforms, and eventually it percolates into academia and then papers, and then it percolates into the policy world, and eventually it percolates up into actual law reforms. But I just, it's really striking to me how drug law reform has always been, all the way back to the sort of harm reduction reforms of the 1980s. It's always been a grassroots, NGO, bottom-up process of reform, and I think that's where it will remain for the time being, anyway. As we move into the next phase of reform, where cannabis and other drugs start to be legalized and regulated.
Yeah, it's a very interesting point, and I'm mindful of something you said to me before we started recording, so I'm not going to say what that was, but I'm going to keep that in mind with what I'm about to say. It kind of has to be grassroots, because if you're a politician, it's in the same way when we criminalized homosexuality in this country. There were campaign groups, there were activists, and there were campaigners. There was nobody in politics. None of the 650 seats that were occupied were supporting, and that's because none of them were publicly out. I don't know if any of them were gay, but statistically,
yeah, they definitely.
mathematically, there's a high probability that at least one of them is going to have a queer identity. And without people at the top being able to go, yeah, I do drugs. Like, I think of Dr. Carl Hart, the amount of shit he took when he came out and went, I use heroin, I use amphetamine. And in his book, and he talks about, and he describes like his usage and I see no different than somebody going home and go, oh, I like a nice stout. Ooh, I like to fill it right at the edge, get the head on, sit in my comfortable chair. It's just a ritualistic thing that I see no difference. But I can see to why others put in this judgment. But why they can't get beyond this idea that if the people up there can do it, and again, it's this idea, it's disappearing over time, but the classist element is still there, just in a different way, as in who gets to benefit from what's coming. Whereas previously it's been, oh, Jeremy got caught with 2 grams of cocaine at Eton. He's got such a bright future. He can't ruin his life. Yet some kid in a common school gets caught with like 0.4 of a gram of fucking weed, and he's suspended, kicked out of a house. He's on the street, and you see these trajectories of life paths. The drugs play no part in it. It's the system's perception of the potential of the person. And that's the thing that really has boiled my piss and brought me into this, is I'm seen as a very low class, common sort of council estate kid from the Northeast. I'm lucky I speak quite well. I'm quite articulate, and I have a passion for knowledge and to acquire information. So that's managed me to challenge that deficit. But generally, I'm still looked at as this, like, oh, you just want everyone to just take drugs and be a waster and drop out and rah. And no, I'm not quite the anarchist I was before. I'm not, let's burn it down and live in the ashes. I believe some reforms can happen. And I believe that some of the things that I detest, that's just my right to detest. I hate the capitalist system we operate under, and I would like to see it change, and I will work to see it change. But I also have to accept it because there are billions that it works for. Wait, millions that it works for. I don't think it'd be billions. Then that's their choice, their prerogative of life. And all I want is drugs to be brought to that same position. That's just what you do. You go play squash on a Saturday morning. All right, if that's what you want to go do. You go play golf. You go do this. You go do that. You do a bit of heroin. Like I think that's where we can
Right.
get to with drugs. Once we lose the moralizing argument, and I think it comes from people higher up talking about it. Because
Yeah.
we have this paradigm of like, oh, the great musicians, the Bill Hicks joke of if you don't like drugs, throw away all your records because all those musicians real fucking high on drugs.
Yeah.
Like, the arts, the creativity, we accept. Look at all this wonderful stuff that these drug people did. But then that guy, that homeless guy in the corner, that druggie, he could be the next them. But it's your prejudice that prevents that.
Yeah, yeah. I mean, there's a whole dialogue about this concept of deviance. It's a sort of criminology term, deviance. And you're right, it's very class-based. It's often very racially charged, or other minority groups who get on the wrong end of that. And these are deeply classist and racist narratives that percolate through all of our policy making and sort of history of law design. You're absolutely right. Almost any activity involves some degree of risks. You talked about squash. People have heart attacks playing squash all the time and die. People playing golf get struck by lightning surprisingly often and die. But we don't therefore then just ban squash and golf. You sort of say, look, if there's a lightning storm, maybe go to the clubhouse. If you've got if you've got heart disease, take it easy while you're playing. You regulate those activities, and it's the same with any risk-taking activity. If they are a reality, and drug use is a reality and has been in almost all societies throughout all kind of human history, going back to hunter-gatherers were consuming plants and berries and licking toads and whatnot to get high as part of some ritual or sacrament or something. Goes all the way back to that, and it's almost like it's part of human nature to this kind of curiosity to alter your state of consciousness. It's just a reality, and that has to be the starting point. That demand for drugs and drug alter states exists and always has and does everywhere, and it will find a way. You can't take a moral position on it and then just think you can legislate it away. And we know that because we've been doing it for 50, 100 years, depending on where you want to start counting. And it's completely not worked. I mean, it's one of the great ironies of the war on drugs is that since it was launched, say we take 1971 Misuse of Drugs Act, Nixon, etc., as a sort of starting point. Since then, when creating a drug-free world was decided to be the goal, a drug-free society, more and more people have taken drugs. And we've spent trillions and trillions on enforcement and policing aimed at both deterring use and eradicating drug markets. But loads more people are taking drugs, and the markets have expanded massively to meet that demand. So, even on its own terms, the war on drugs and the whole prohibitionist paradigm has been an abject and total failure. All of the outcomes have moved in the opposite direction. And it's not just that it's failed on its own terms, it's also created all these other problems, criminalizing hundreds of millions of people, filling our prisons with people who use drugs or people who sell drugs. Particularly people from marginalized, minoritized communities have taken the brunt of that. And it's created this illegal market controlled by organized crime groups that causes chaos and violence and child exploitation and death across the world, not just on the streets of British cities and, well, not everywhere, not just the cities, but also all the way through to Colombia and Afghanistan, and places like that, Morocco, where a lot of our drugs may come from, and all the places in between that the drugs are transited through, like the Caribbean and Central America and West Africa. It's just causing chaos and violence and death and suffering across the world. So it's been a massive failure, and the whole public health ethos. It actually makes drugs which are intrinsically risky more risky. It increases the risk of drugs for people who use them, and people are using them and always will. And I think the reality of drug use and the reality of drug use in society, whether we approve of it or not morally, doesn't really matter. It has, as a pragmatic policymaker, it has to be your starting point that drugs, for better or worse, to a greater or lesser extent, exist in society. And as responsible policymakers, we have to manage that to reduce the harms it causes and maximize benefits, to reduce the harms it causes both to the people who use them and to the wider society. And that has to be your starting point. You can take a moral position on drug use, but as policymakers, we have to take a moral position on policy, like what policy and law will deliver the best outcomes in terms of public health, crime reduction, human rights, sustainable development, effective expenditure, and so on. Because at the moment, what we're doing on the basis of a moral message that drugs are bad is actually causing all of these shitty, terrible outcomes. It doesn't work. It makes things worse. We know that from more than half a century of fighting this war on drugs. That has to be your starting point in any debate on policy and policy reform.
100%. I think it's the decoupling of the emotive reaction of individuals, and I've spoken to thousands of people around the world. I've spent a lot of time in this space, and the one thing I come down to with the most ardent prohibitionist is an experience of hurt or harm that they have had. And for all there were some amazing campaigners, there's a woman in this country whose name escapes my brain, and she lost 2 of her teenage sons to ecstasy adulteration. And she campaigns for decriminalized, legalized. She's just like, end the fucking war. Like, just whatever the requirement is to make sure that that never happens again, do it. Whereas I've met other people on the other side that are like, but if they hadn't have taken that drug, and they can't get past this. I wouldn't have taken that drug, so why would another person take it? Do you know what I mean? So I'm a vegan. I don't eat meat, but I'm not a militant vegan being like, I'm going to go tackle play. I've made the choice. It hurts me that others make their choice, but that's not my choice. Do you know what I mean? It can bother me when my mate sits there and eats a steak or whatever, but he's made that choice. It bothers me that the cow didn't make that choice. But in this drug thing, it's the adult thing. It comes down to me as like kink and sexual fetishization. As 2 consenting adults, as more consenting adults, you can do what the hell you want sexually with each other. You can have all kinds of poly combinations of sexual relation interactions, and as long as you don't try and get married, then there's no problem there. And everyone's, people again can be like, but you're not allowed to do anything. You can't go ring the police. You can't go, there's an orgy happening in a private place. Like,
yeah, I mean, I think I'm not averse to prevention stuff for young people. I don't mind the idea of giving young people cool stuff to do, but give them youth centres and sports facilities and music clubs and whatnot, and get them to do cool stuff if it increases the age of initiation to drugs, or reduces their use of drugs, or makes them make a choice to not use drugs. I'm absolutely fine, and I absolutely think that they should be given the knowledge to understand the risks of drugs, and also that not using drugs is a completely valid choice if you want to make it. I'm absolutely fine with all of that. Prevention, I think, it can be, if it's done properly and responsibly, and it's not politically driven, if it's evidence-based, can be a good thing. Particularly, I'm talking about young people here and non-adults. But you see, you have to remember that it doesn't work for everybody. And for the people it doesn't work for, the substantial minority of people who it doesn't work for, you have to manage that. You have to you can't just abandon 20, 30, 40% of the population because prevention messages haven't worked for them, or abstinence messages haven't worked for them, because they just don't work for everybody. We know that. Because we've been doing prevention for all this time, and a lot of people still choose to use drugs. They make an informed decision, hopefully informed decision, that the risks to their health and risks of legal consequences are outweighed by the benefits that they derive, whether that's pleasure or relaxation or some sort of spiritual enlightenment or whatever it is. They make that choice. And again, policymakers have got to, that has to be your starting point. It's the world we live in. You can't just imagine a world that has no drugs in it and go, right, that's the one. That's not the world we live in. So that's your starting point. And then you have to go, okay, if drugs are here, what is the best option for controlling and managing that reality? And the conclusion that we've come to at Transform is that you shouldn't criminalize people who use drugs. That's counterproductive, harmful, doesn't work, it's expensive and stupid. But not just that you end the criminalization of people who use drugs, which is effectively what decriminalization refers to, but that you need to take control of the market as well, because the market is there to meet that demand. Again, whether you like it or not, there will be a market, and you either leave it in the hands of organized crime groups and unregulated street dealers and the chaos of cartels and in Colombia and Afghanistan and all the rest of it, or you bring it within the ambit of appropriate government agencies and you regulate it responsibly, like we regulate everything else, because we regulate everything. We regulate alcohol and tobacco, we regulate the packaging of food, we regulate roads and cars, we regulate power tools and dangerous sports. The sofas that you sit on have fire retardant foam in them. And that is mandated by law, by regulations. The plugs that your computer is plugged into and the plug sockets are regulated to make sure they don't burst into flames and set fire to your sofa, which will be fine, by the way, because it's got fire retardant foam in it. But one of the key things that governments do is to regulate risky products and behaviors to protect the public from risk. It's all about risk management and, to a certain extent, benefit maximization. But it's what governments do, and what we need to do is to apply all of that knowledge and scholarship around how to responsibly regulate risky products and behaviors to a group of products and behaviors that, for weird historical reasons that are sort of lost in time, have always sat outside that. And it's not even just some drugs. It's not even all drugs. It's just some drugs, because obviously alcohol, tobacco, various other poppers, a few other random drugs for strange reasons are regulated. When you buy a pack of fags, it has a picture of, some cancerous lungs on it, and says don't smoke, or, smoking will make you impotent or give you heart disease or give up because it's really bad for you. It says it on the package, and you know how much nicotine it is. You pay tax. It's regulated. You can't buy it if you're under 16. All the things that you might want to do with currently illegal drugs is already done with pharmaceuticals, alcohol, tobacco, poppers, whatever. So it's not like we don't know how to regulate risky drugs. We just choose, for these weird historical reasons, to not do it with cannabis, ecstasy, cocaine, whatever, magic mushroom. So it's what Transform has done is to apply that regulatory thinking and a regulatory logic to those other drugs and come up with a plan. Now, we may not have got it all right, and people should read those books and discussion papers and blogs and whatnot that we've done, and we can discuss the detail. But what we've tried to do is to start that conversation by coming up with a vision, a plan that we think would work, certainly better than what we have now, and put it out there to get that discussion going. Because it's not good enough to just say the war on drugs doesn't work. You need to be able to promote a vision, a credible vision of what a post-prohibition world looks like that people can buy into. People who use drugs, the communities they live in, and policymakers and relevant authorities in health, policing, and so on. So that's what we've done. And, I kind of think we're winning, because, you can see the change happening. 10 years ago, 2012, nowhere in the world had legalized cannabis. Nowhere. But just over 10 years.
North Korea.
Well, I don't think they ever criminalized it, but nowhere, formally legalized.
Yeah, I was just being obtuse.
No, it's fine. Even the Netherlands, it was a sort of fake legalization. It wasn't real.
Tolerance.
Tolerance system. So, but then 10 years later, you've got more than 500 million people are now living in legal cannabis jurisdictions where they have or are in the process of implementing legal cannabis. And you've seen this wave of reform across North America, Canada, Mexico, 22 US states. In Latin America, you've got Uruguay, places like Colombia are trying to do it. Other countries, there's really active debates in Brazil and Argentina and elsewhere. And then in Europe now, you've got like Czech Republic, Switzerland, the Netherlands, Germany, Malta, are in the process of or have already implemented some form of legal legalization, legal access. Now, they're not perfect. There's problems with these things. They're going to need to evolve. And Transform, I think it's worth clocking has been involved in a lot of those processes. Not by no means all of them, but we were very involved in Uruguay. We've been very involved with the Federal Task Force in Canada. I've been working with the government in Malta, the government in the Czech Republic, and the Netherlands and Germany, actually. And, these things are moving, but it's not just even Europe and North America and South America. There's also South Africa has effectively legalized personal cultivation use of cannabis. Several states in Australia have done the same. So and Thailand on every bit of chaotic, bit of a mess in Thailand, but nonetheless, it's happening on every continent. You're seeing what was formerly 10, 15 years ago would have been thought unthinkable is now happening. And I think that should give people confidence and optimism that change is possible because it is happening. Things that were seen as completely, off the wall 15 years ago are now happening on every continent. So, we can win the arguments and turn those wins into real world change. And if you want evidence of that, just look around you, because the wave of reform in North America, in Europe, and around the world is evidence of that success.
Yeah, I think it's undeniable that it's moving forward. I mean, my fear is what it's moving towards and what is being allowed to happen, because I don't think we're winning the war for recreational drugs, if we're to use such a parlance. I think the reason that drugs are moving forward is because of the medicalisation of all drugs. There was obviously the early 90s report with some of the individuals that went on to form GW Pharmaceuticals, called the Medicalisation of Cannabis, that set out basically a 30-year plan for the creation of a global powerhouse of the UK for cannabinoids and also called medical cannabis. And it reminded me there, and I wanted to pull up the quote because I wanted to get it right, because I sometimes butcher it, of John Ehrlichman, Nixon's drug advisor, who in the early 90s was talking about the origins of the war on drugs. And so the quote that he gave to, I can't remember which paper it was at the time, or magazine. There you go. And he said
that was where it was reported. Sorry.
Yeah, sorry, where it was reported. I think it was somewhere else that he gave it to. But he said, yeah, basically, you want to know what this was all about? Nixon had two enemies, the anti-war left and black people. We knew we couldn't make it illegal to be either against the war or black, but by getting the public to associate the hippies with marijuana and the blacks with heroin, and then criminalizing both heavily, we could disrupt their communities. This is a short quote. It's usually says disrupt the communities, vilify them night after night in the evening news, and break up their meetings. And I can't help but feel like that was the one intention for the modern war on drugs. There is a document from 1955, the World Health, the IHO's Actor, I think the document's called. One of the university professors, James Mills, at Clathside, I'm sorry, my Scottish fans, Clathside, Clydeside, I can't pronounce it in my head. It's got a Y in it and a D, and it's a side, or I think. Up in Scotland, this dude, and he found this thing, and it basically showed that when they were putting the precursor together after the opium conventions, there was a document that was basically created that said that the global drug trade could only be controlled by state actors. And that, plus this medicalisation report and what we're seeing now with the explosion of, I can go take ayahuasca if I fly here, I can go get ketamine infusion if I pay $6,000 here, I can go do this here, feels like, again, that classism. The lower classes with their self-access and their culture, and they're getting together and sharing these drugs and coming up with alternative ideas that may challenge the status quo paradigm of the authorities, is still problematic. So we're still demonizing and vilifying that. But the medicalisation, no, trust the establishment and pay us money, and you love us and support us because we're helping you, and don't look into it yourself, and don't become self-sufficient, and don't grow your own, and don't look at the research, and don't think about all the other millions of people that are getting screwed over so that you can be safe. It feels like that's the trajectory we're on. We've gone past this dip of them going, yeah, you're right, yeah, drugs aren't bad, they're medicine. And then they're just going straight towards this paradigm of regulated control where the individuals will always be limited. And every model that you mentioned before, it's still limited. Malta's probably one of the better ones. I think New York possession limit is at least the only one that's rational. Not the plant number. I think it's still only 3 per person, 6 per household, but their household limit is £5, 2.5 kilograms. That makes sense. If you've grown weed, you know what weed does. Whereas the Germans going 3 plants for 48 grams or whatever is just not possible.
No, it is stupid to have a 3, 4, 5 plant limit and then a 50-gram.
So to me, it feels like all of those limitations on the individual are to stop individuals or non approved systems, like the upper up's not approved. So if 25 cannabis consumers from a council estate got together and set up a club and a business, and all that money started going in their pockets, and they could start getting out of that class, I think that's where they see the problem. I think that's what the whole war on drugs is predicated on. I don't think they believe the moralizing argument, because we wouldn't then find meth in the Home Office. We wouldn't consistently find cocaine in the Houses of Parliament.
Mm.
Do you know what I mean? Everybody takes drugs, or everybody has the potential to take drugs. And this is one of the things I've learned through my work in cannabis. I mean, I was sat at our last event talking to two retired school teachers, both in their 70s. Lovely ladies. They're so unassuming. Both of them grow their own. One of them was like, "Oh, I remember I was in the 1972 rally and we were fighting for it." And we were having this conversation. Like, well, what the hell has actually changed?
Yeah, that's
And they
50
were like,
years.
yeah, a lot has changed for, again, the research. We now know about the endocannabinoid system, about different cannabinoids like THC. We're starting to understand about cannabinoids as neurotransmitters. We're starting to understand like how MDMA, ketamine, and these other drugs can work in a holistic, alternative approach to mental health. I mean, you got people that, and we kind of knew this in the 1960s and 70s, ecstasy was the love drug. There's some amazing, amazing, beautifully written stories of these underground practitioners, quite often like male and female, like husband and wife, that would do these treatments with people, and the stories that would come out of it. And couples that there was, I can't remember which township it was basically like an unofficial thing before ecstasy was criminalized, where divorced couples were given an option to go to this therapy, and the divorce rate fell off a fucking cliff. Once they took ecstasy together, the couples actually talked about their shit,
Yeah.
realized they loved each other, and didn't want to get divorced. They were able to actually talk honestly and openly and reconnect and deal with the trauma of humanity. Yet where
Yeah,
we
I
are
mean,
now is MAPS becoming a fucking for-profit pharmaceutical company to put soldiers back into warfare.
yeah, I mean,
I feel like we've missed the point, you
I
know?
think I think you're right that there has been a trend towards sort of medicalisation as a sort of wedge or at least as a sort of pathway to wider regulation. And I think there are some advantages to that, and there are also pitfalls. You know, I think if you can show that something can be responsibly regulated, then and that in a sort of clinical context that something can be safe or relatively very safe,
Mm.
and it isn't associated with the problems of a legal market, that can reassure people. And we've certainly seen that with cannabis. Often usually medical cannabis reforms do precede non-medical recreational cannabis reforms. But I do have worries about it, because a medical regulatory system is fundamentally different to a non-medical one. Your goals are different. You know, you have medical outcome goals, which are not the same as managing non-medical use. And I think when people start to use medical as a sort of tool because their ultimate goal is non-medical, I worry about that. You know, if you're sincere medical campaigner for cannabis or MDMA or magic or psychedelics or whatever, great. But we need to be careful not to undermine medical establishments and medical institutions and medical regulatory systems by not bad actors, but people kind of exploiting those systems because they have a different agenda. And I also think there's a danger of drug exceptionalism. You know, some drugs that have obvious medical benefits, like psychedelics for certain psychiatric conditions, or like cannabis for all kinds of things, people can become very sort of precious and say, well, my drug's sort of better than yours, or this one should be legalized first because of X, Y, Z. And that risks stigmatizing people who use other drugs. And those other drugs may not have any particular medical uses. I mean, most drugs do, but not by no means all of them.
I think it'd be
Um,
accepted medical uses. Because
yeah, and we have to. So, and I don't know, and I'm also wary of kind of informal medical systems that operate, you know, outside of, you know, formal medical structures and doctors' advice. You know, people sort of saying, oh, you should, you know, don't take those cancer drugs. You should use this cannabis product. I worry about things like that. It's a bit like people saying you should, you know, drink carrot juice to cure AIDS or something. That, you know, there is outside medicines and medical treatments are regulated and researched for good reason, because there are people who are exploited. There is snake oil salesmen. There are bad actors who seek to profit from, exploiting people's vulnerabilities and illness. There are lots of great people in the informal cannabis scene, but there are also bad actors who who either don't know what they're doing and put people at risk, or are just trying to make money off people's illness and vulnerability. So we have to be careful. I feel like medical systems exist for a reason, but also medical regulation is different. So we need to, even though it may facilitate a debate around wider drug law reform, we need to be careful to keep them separate and not. There's some overlap, but we have to be. I'm quite wary of medical cannabis, for example, being seen as a kind of inevitable pathway to non-medical. I think we need to make the arguments for non-medical cannabis regulation on their own merits, and not bring, when there's, there are folks within the cannabis scene who sort of say all cannabis use is medical, or cannabis is a medicine, it's not a drug, or cannabis is a healing plant, and all these things which they're not complete nonsense, but they're also not useful. I don't think think those are useful arguments to make. I think we need to make the arguments for non-medical cannabis regulation on its own merits, and that goes back to what I was saying earlier. Loads of people use cannabis. An illegal market makes any risks that exist with cannabis greater. It empowers organized crime groups and street dealers. It leads to criminalization of lots of people, particularly for minorities. That is why we need to address it. And these are the questions we need to answer about: how do we regulate production? How do we regulate availability, supply? What products do we regulate? Price, tax, packaging, information, blah, 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 and all the policy stuff that goes around it. How do we educate young people about making responsible choices about their cannabis use or their other drug use? How do we deal with people who get into problems with their cannabis use? Because some people do, and you need to have services available to them. People need to be unafraid to use those services if they want to cut down, or if they have become dependent, or if they're whatever it is. So there's lots of questions that need to be worked through. And I think the good thing is that we are there now. People accept that cannabis prohibition hasn't worked, that something needs to replace it. And now the public debate is at the point of, okay, how do we regulate it? So we've moved more to, people discussing the risks of over commercialization or corporate capture of cannabis markets. And you see these big billion-dollar corporations in the US, like, Aurora and Tilray and Greenleaf, and these mega corporations who are fundamentally trying to make money. They are not there for the betterment of humankind. They are there for the enrichment of their investors and shareholders and their board. And to that extent, I think often in the public policy debate, they're not good faith actors, because their interests is to shape policy to enable them to extract more money from the cannabis market. And that means expanding use. And they don't fundamentally care about public health or human rights or social justice or sustainable development or the environment or any of those things. They want to make as much money as possible. So, one of the things that we've pushed hard on with cannabis policy is to try and rein in the corporates and rein in corporate and the risks that come with corporate capture of the market and the policymaking process, because they've got so much money to do lobbying and advocacy and PR that they can influence policymakers. They can influence the design. They produce draft legislation which they give to policymakers and go, look, here you go. And then it's all quite cleverly written to look good, but then there's little bits in it that serve their interests. And we've also been pushing really strongly on equity and social justice. So there's these amazing, you talked about New York earlier, there's these amazing policies that have emerged in the US. Some are better than others, but the idea of social justice being embedded within the legislative design, so that the people who've been hit hardest by cannabis prohibition historically are able to benefit from and participate in the emerging market. So you design your policy to prevent corporates taking over, to create a diverse and equitable market that everyone can participate in with, and you actually actively support disproportionately impacted communities to participate in those markets. So, you preference equity applicants from disadvantaged communities in the licensing process, and you provide training, and a proportion of the tax take, which in many states in the US amounts to hundreds of millions. You redirect a proportion of that tax take back into those impacted communities, and you expunge criminal records. So it's not just ensuring social justice going forward, there's a reparative dimension to it too. It's kind of like reparations. You try and repair the harms of the war on drugs in the past, as well as making sure things work better getting forward. So we've been very keen to emphasize, getting on top of corporate capture, preventing kind of corporatization that we see with alcohol and tobacco, by the way. You've got 4 or 5 big alcohol and tobacco companies dominate 85, 90% of the market globally, and they are so big and so rich and so powerful. They can dominate policymaking processes, particularly in smaller countries. They can literally go in and draft the legislation to design for them to extract as much money from possible as, from alcohol and tobacco. So we need to make sure that doesn't happen, but we also need to make sure that, we can use the design of cannabis regulation going forward as a way to demonstrate a better way of doing things, where you do have a more equitable, a diverse market that encourages participation of a wider spectrum of society, and the benefits of that market are more evenly shared, both in terms of participation, but also in terms of how the tax revenue. So like in New York, 40% of the tax revenue from New York is directed back into social programs in communities that have been disproportionately impacted by the war on drugs. 40% of the tax revenue. Think about that. If that was, oil going into environmental causes, or if that was, almost any industry going, that 40%. In New Jersey, it's 70% of the tax revenue is redirected back into social programs in impacted communities. I mean, that's pretty remarkable. And this is in the home of both the war on drugs and the sort of home of, contemporary capitalism. So it's amazing what's possible. We need to build on that and develop it, and that has been a big emphasis of Transform's work in terms of how we move forward with cannabis policy.
No, I think all good and relevant. The one thing that kept banging off my head there was, I appreciate and respect, obviously, the social inclusion and equity programs, the attempt at restorative justice. One thing that I can't help but feel, and I know a lot of my grower friends are about to agree with me here, if the regulations, like you said, weren't written with the corporate interest in mind, we want cap it at 150,000 square feet. Why? Because that's the facility we own. We don't want anything smaller than this. Why? Because then they can get their hands on it. They can't afford to buy that plot. We want the license to be this much. Why? Because they can't afford it, but we can. So all those restrictions, and then when they come and go, this is what the product should look like, this is how it should be packaged, they determine all of this stuff for peripheral income, because they control the distribution, they control the financing, they control the logistics, they control the retail, they make they're a vertically integrated new nascent market. And they, like I said, they are dominating, absolutely dominating. But if they couldn't restrict the markets and the people that we're then putting this money to go, here's some money, and giving them charity to get them off their knees, we have to recognize they're on their knees because of those people in this system, the perpetuation of the war. So yes, we have to have that restorative thing, but it can't just be, oh, poor you, here you go. I think we have to handicap the big boys, actively handicap them. And so, if you got a criminal record for growing weed, then you get first dibs at growing weed. Like your criminal record should become your CV within this. And once you've then dealt with it, it's the same as like what the argument I say, we need stakeholders. And it has to be this argument of, I keep saying, of class. If you don't think of the council estate kid and you set up and build your model, guess what we're going to do? We're going to fill houses and we're going to undercut you. The same thing happened in Canada and still is happening in Canada. Same thing's happening in California and other markets. Where the legacy is locked out, they'll continue. We fought this war for 70 years. We can survive legalization. We survived criminalization. Do you know what I mean? It's now easier. It's just tax. And I get a form and a fine and oops. And people are fighting and conglomerating. There's unions forming. There's people starting to fight back against these systems because, as you say, they've become so heavily captured by neoliberal capitalist interest. And I don't know how to do that without this, and this will lead us on perfectly to the main part of what we want to talk about today, the new legalization campaign, is how legalization can exist, legalization with a small L, can exist without decriminalization. If there are any handicaps and any limitations applied to the individual that aren't to the corporation, then we fucked it. I should be able to grow as much weed at home as possible. Like if I can fill every square inch of my flat, I should be able to do it with no restrictions. and then sell it as the same as like we used to with the gift economy, or like when cigarettes got banned at festivals, and the first year all the vendors were like, "We'll sell you this lighter for £10, and attached to the lighter by a rubber band with a pack of cigarettes for free." Because they didn't technically sell that. Like if we could have, as long as there's gift economies and car booties and non like ways of the language to work that we can survive. Because as you spoke of before, street dealers and organized gangs, not all of them are bad. I know
No.
several collectives of great people that their kids eat because people buy their weed.
Yes, I don't, and I think it's in the same way we mustn't stigmatize users. I think we need to be careful about stigmatizing dealers, because you do
100.
quite often get that with decrim policies. Like, we're going to decriminalize the consumer, but we're going to come down extra hard on the dealers. And absolutely, not every, a lot of producers and dealers aren't problematic at all, and a lot of them are very, decent, principled people doing great stuff. The majority of the market, and I don't have a percentage figure before you ask me, but the majority of the market for cannabis in the UK, however, isn't, I don't think, your kind of cannabis social club type ethical producer, dealer, community-based things. It is organized crime groups growing, sort of hydroponic under lights stuff with loads of pesticides and fertilizers and heavy metals, and often, using often slave labor, illegally trafficked people, often young people, working effectively indentured labor in, a underground, container ship sort of light growing light setup. So we've got to be careful about not stigmatizing the grow all growers and dealers, but the organized crime groups do still control majority of the market in UK, and that is the problematic bit. I think you're absolutely right. As we progress to a legal regulatory system, post legalization system, you do need to make sure that the good actors within the legacy market are there is a pathway for them to operate, continue. I think within a legal system, I do think that producers should be licensed. It's certainly if they're operating on a commercial level. I think if there's anything I disagree with you, I think, in terms of home growing, you say you should be able to grow as much as you like and then and sell it and share it. I'm not quite sure exactly what you were alluding to, but I think if people are selling stuff, when it becomes transactional or commercial, I think then it should be regulated, because
Well, yeah, I mean, but there's
I
different,
think you
there's
need to
different
have
ways.
quality.
There's
I think
different
you
ways.
need to have, sorry, go on.
No, sorry, I was gonna say there's different ways of regulating. So Ethel bakes a couple of cakes for the local cake shop. They're doing a raffle for the community centre to raise some funds. The regulation that is then applied upon her, if she poisons somebody at that, there is then I can't remember the three words. There is an agency in the UK that would then deal with that.
Yeah.
But that would then be dealt with effectively as a civil thing, unless it was found to be intentional, then it would become a criminal offence.
Yeah.
And so I would want, as we said before, of the vast majority of regulation exists already. If we took out the moralizing of drugs and ripped up the 71 internationally, ideally the 61, 71, 88 convention, then we wouldn't have then the 71 Drugs Act here, or the 2001 amendments, 28 amendment, all the other crap that we've got. We already have the regulation, basic hygiene, health and safety, sanitation. There's already enough regulations that when you become a commercial entity, yeah. So I guess there would then have to be a reasonable cap. But what I'm meaning is that I see cannabis as cannabis justice as class justice. That everybody that is poor could put up a 1.5. I mean, they get all their weed for free, and they could pay their electricity, the newts and the materials, by selling a couple of ounces, even though maybe 5 ounces a year, to a few friends.
Right.
Do you know what I mean? I want that kind of thing to exist. And the thing of like, so I take a lot of oil as well. And so then the amount that I would have to produce to get oil and have flour looks, oh my God, look at all this cannabis. But yeah, if you've only got a plant that's returning, like, I don't know, like 3% for FECO, so that huge plant, the cop's like, oh my God, that's 10,000 pounds. And you're like, yeah, mate, that's 10 grams. Dependent on the person, that could be a week's worth of oil. Like we need to understand the levels of it, because the cops just go, each plant is now, I think the assumption is 56 grams. So they assume each plant is now 2 ounces at £10 a gram. And that's the standard measure for prosecution across the country. Yet you need to consider how the dealer operates. There's people around here that will sell you a 20 quid eighth. there's vendors down the way that will sell you a 50 quid eighth in a Mylar pack. Like there's a whole
Right.
spectrum to the market. But if it's just Dave and it's like borrowing a cup of sugar, like I'm quite lucky. I have several dealer mates, grower mates, that when I run out, I can ring them up and go, can I borrow an ounce? Not can I buy an ounce? Can I borrow one and I'll return you one? And then when they run out, they ring me or they ring somebody else. And we've got several of us that then none of us are buying it. We're all looking after each other and making sure that, oh, well, you did, yeah, it's the same as borrowing a cup of sugar from next door. We don't see it as a thing. It's something we all utilize and use.
Yeah, I'm absolutely fine with all of that. And if you look at what we are proposing in terms of the stuff that's in our book, and just to say for people listening, we've written Transform's produced a book called How to Regulate Cannabis: A Practical Guide, and it is a very detailed, quite boring book. There's chapters on tax, there's chapters on packaging, there's chapters on licensing, there's chapters on product controls and blah blah blah. It's like a 400-page textbook on regulation based on and it's in its third edition now, and it's evolving based on our experience working with governments and growers and markets around the world. And it's free online. You can buy a hard copy, but you can just download the ebook if you want and just have a read. And there's an executive summary if you can't face a 400-page full Monty. And there's chapters in there on cannabis and driving. There's chapters on cannabis and the UN conventions and all the rest of it. There's a lot of detail. But what we propose is a kind of mixed economy model for cannabis, where there would be provisions for home growing and non-profit sharing. There would be provisions for cannabis social clubs or some non-profit membership-based associations, a bit like the Spanish model or the new Malta model that we were very involved in. And there would be provisions for a regulated retail market. So there would be stores or online outlets selling cannabis that was quality controlled and regulated in the same way that alcohol and tobacco are, but hopefully better than that. And there would be consumption spaces as well. So something a bit more like the Dutch coffee shops where you could go and consume on site. And independently of all of that, so those three models, home grow, social clubs, and retail, would be regulated by a national agency, a sort of cannabis regulatory body. And then independently of that, you'd have a medical provision pipeline for prescribed cannabis. Now, I don't want to get too much into the medical stuff, as is not the focus of medical cannabis is not the focus of Transform's work. We don't claim particular expertise on that. We historically haven't avoided it or ignored it, but it's not been the focus of our advocacy. Our expertise and experience working with governments and so on has been around non-medical cannabis, which is the overwhelming majority of the market. And in the UK, nominally medical cannabis is now legal. Obviously, there are massive problems with access and so on, and that needs to be reformed, but that isn't the focus of our work. And there are other organizations and individuals like yourself doing great work on that. We focus on the bit that's still criminalized and prohibited, and getting that changed and putting in place a really solid multi-tiered regulatory system that meets everybody's needs. And I hope the idea of having a retail model, so non-profit social clubs and home grow provisions, would hopefully meet the needs of all the different types of users and growers and so on within that market. So the regulated retail bit is kind of what I was talking about earlier in terms of fighting off corporate capture and making sure we have a diverse, equitable system. But it does need to be regulated. And if people have the social clubs are kind of self-regulating, and that's great. Home grow, it does need to be regulated up to an extent. I think there are discussions to be had around how home grow work. As soon as you put in plant limits, you're creating problems because plants can vary so enormously. An outdoor plant, like you say, can grow pounds of weed, not just
surely if it if it's then an issue of safety, it's something I've always thought, like, and the hydro industry is unbelievably insular. I'm gonna try not to betray anybody's trust here, guys. I know I talk to a lot of people, and obviously I try not to mention a lot of what goes on there because it is such a contentious part of the industry. They're not cannabis, but if they didn't supply cannabis people, there wouldn't be a hydro industry, we'll put it that way. Not everybody grows tomatoes, we'll say. But there's some products in some of these businesses that are fucking toxins. Poison, literal poison.
Right. So I think those things have to be regulated.
Exactly. But they're not regulated because they're sold in a shop that is, oh, we sell for ornamental stuff. You can put this on your ornamental plants because you're not going to consume them. Or you're going to put this into something and this product is safe for ingestion, and your stomach acid it can destroy so many things. When you volatilize that chemical, though, it becomes cancerous or toxic. And
Right.
because then we can't have that acceptance. So I agree in that sense that needs that normalization. And so what I'm saying is if we had commercial regulation, so rather than limit the individual, if you then go, all right, we're not going to sell 4x4 meter tents. You know what I mean? You can't buy those without a license or whatever. So you can only buy up to a 3x3. Or then you can only buy, like, if you regulate the limit of the access of the materials, then I'm down with that. The idea of, in my head, it always comes down to Gestapo. Knock, knock, what is it? Cannabis Bureau, we've come to check on your plants.
Yeah, no,
Anything like that is just,
obviously don't want that.
oh.
And with sort of trying to regulate home grow, and we do write about this in the book, by the way. There is a section on home grow where we outline that there's obvious problems with trying to, if you put in any controls, there's obvious problems with any enforcement. From, you know, to my mind, the sort of good faith growers who grow good quality products and then share it on a non-profit basis amongst their friends or their peer group, community, whatever. I don't think that's a problem. But the
Why is the profit an issue?
Profit is an issue because as soon as there's profit involved, you create incentives to expand and grow. And as soon as you move into a sort of a profit-driven market, the dynamics change, because there'd be an incentive to use certain fertilizers or pesticides or grow techniques that might make for products and if people are then selling it for profit, I feel there needs to be some kind of regulatory oversight on that. Because if people are selling it, you know, you don't want people selling it to kids. You don't want people selling cannabis that has pesticides or fertilizers or heavy metals or whatever, fungus, that is dangerous to consumers. And you see, that is what regulation is for. The problem with regulation, the challenge for regulators, is that it only takes one bad actor doing something stupid that you need to then put in a tier of regulation to prevent that, even though most people don't do that. So like that, there was that one, remember that one idiot who went on a plane with a bomb in his shoe? Do you remember that guy in the heel of his shoe, and he then tried to blow up the plane? Right. Since that one idiot, everybody has to take their shoes off and get them like scanned when they go through airport security. It's the sort of curse of regulation, is that bad actors mess everything up for everybody else. And you know, a responsible regulatory system can't just say, oh, you're free to grow whatever cannabis you like and sell it to whoever you like. Because unfortunately, whilst most people would act in good faith and do that in a responsible way, and they wouldn't sell to kids and they wouldn't sell shitty weed with crap in it, a few people would, and that is a problem. And unfortunately, regulation has to cater for the small minority of bad actors, because that is, you know, it's a bit like speeding, you know, it's a bit like rules of the road and driving. You know, we have, most people aren't going to want to drive recklessly or endanger other people, but a few people do, and that's why you then need rules, which can sometimes be annoying for the safe drivers. So it's sort of the curse of regulation, is that bad actors mess it up for everyone else. And I think it's easy to, when you're in a position of around a lot of, you know, ethical, good actors within the cannabis community who are doing good stuff, producing good weed, sharing it on a basis, maybe making a little bit of money, and that can help them. But it's easy to forget that there are bad actors as well, and policymakers have to deal with all of that. And the problem is, you know, the bad actors mess everything up for everyone else. So you know, where that leads, one of the places that leads is that it's important for the community to try and self-police, because each time one person does something shitty and creates problems, it creates problems for everybody, because the system has to adapt and react to that. So, you know, if possible, I wouldn't want to have any plant limits or production limits at all for home growing. But if you didn't have any limits, and then someone grows 100 plants and just starts selling it out of their front lawn, some people would think that's fine. For me, I don't, because the products have to be regular. You have to have some oversight over the safety of the products, and are they paying tax and blah blah blah. So it's sort of,
Well, I mean, again, the point on just on
Compromise.
just on the home grow thing, every home grower in this country pays more tax than Google, Amazon, Starbucks, fucking Microsoft. I could go on with corporations. They
I
pay tax
agree.
on their newts, on their lights, on their feed, on their soil, on their equipment, on everything. They are even like, yeah, even there's people stealing your electric, which I agree is an offense and you shouldn't do. I'm anti-theft. We can argue about again stealing bread for a need, but I don't think that's a need. Get your initial investment, get set up. Weed makes money. But yeah, my issue is then everything you've said I agree with, but also is then true of the corporations on the other
Yeah.
side. So
What you need to
it's
do,
and
you need to
we're
do,
seeing that in the medical market now with seeds being distributed to people, the lack of consistency and continuity, the amount of money that is being made in the space. I mean, as a grower, allegedly, as somebody that may or may not grow, I could produce an ounce for £20. £20. Like once you like even less if I take out like that's minus my labor, but then if I really worked out the math down, you could tweak it even lower. Like it's a very cheap product to produce.
yeah,
And but the more steps you have, the more hands that need to get paid. And I think that's what happens with the corporate regulatory system is then the price of the end product becomes so ridiculous that they go to dealer Dave and Dave goes, how much? Here you go, dude. And so the we have to balance this thing because otherwise you're going to see exactly what we're seeing, like I said, in California or other places, where for all they're now using the law to destroy the legacy culture and market. And look at Mendo, 250 down to 30 families, I think we're down to now. Um, they're going to try and survive and come through this, but they're all now tarred as villains and demons. If you're
yeah.
not involved in the lawful cannabis space, but you're in a lawful area, you must be a bad person. And it just, like I said, it's filtering this system, and it's to me, it's going, who's greed, who wants money, and they're getting risen to the tops,
Yeah,
to the top.
listen. I totally agree with you, and I think you hit on a really important point, which is around balance. How do you balance the interests of the different stakeholders, the legacy market, the equity candidates, the legitimate business interests, which there are some. How do you balance policing bad actors against enabling good actors? How do you balance the interests of public health against the interests of private profit or personal freedoms? There's a lot of difficult questions here, and
Mm,
inevitably some compromises are needed. And I think it's important for people in the cannabis community, just as it is important for the people in policymaking or police or public health or whatever it is, to understand that any model that we alight on isn't going to please everybody. Not everyone gets
yeah.
everything that they want. Not everybody gets everything that they want. There is some compromise. But I think what we are proposing, a kind of multi-tiered model where you have home grow provisions, you have the cannabis social clubs operating on a non-profit basis, and you have a equitably regulated retail market. I think, and you have and medical provisions as well, a prescription clinical model. I think that covers most of your bases and allows space for the different elements of the cannabis community. Because there's an enormous, some people just have a joint once in a while at a party, or they're going to a festival and they buy an eighth, and then
Mhm.
the rest of the time they're not smoking or using at all. And you have other people who are using medically. There are other people who are using every day. There's other people. There's a whole range of different
Yeah.
users and motivations. It's not just the kind of connoisseur market. There is enormous amount of variation and diversity. We have to cater for all of it as
Mhm.
responsible policymakers. One thing I would say is that how you implement a policy like that, even if we can agree on the vision of a kind of four-tiered market with medical, home grow, retail, and cannabis social clubs as the end point, how you get there is actually really important. So
Mm.
if you look at Germany or Malta, for example, where they've started with home grow and social clubs, if you decriminalize possession, that absolutely and use absolutely has to happen, and small scale cultivation. But
Would you again? So the possession thing, the German has a possession limit. They also have a time limit of when you can consume outside, etc. Like, what is Transform advocating for in this new Legalise UK campaign?
well, I mean, I'm hopefully I'm kind of talking about so you have
Yeah,
the
I just wanted to in that
vision,
I
yeah, the
almost
vision
put it into a bubble for people to know we're now talking about that thing and to keep it within
yeah,
almost the
no,
remit
that's
of that.
so well, part of this is we are going to be talking to people about the details, but the overarching vision in the long term is to have home grow provisions, cannabis social clubs that would be regulated, an equitably regulated retail market, and a separate medical prescribed provision model. Um, But the rollout, the stages to get there, I think is really important. So if you begin by decriminalizing and allowing home growing and regulated cannabis social clubs, a bit like in Malta or parts of Uruguay or elements of the German model, all of which have their problems, by the way. I'm not advocating. I worked on all of them, but I'm not, we didn't get to design everything. We made recommendations, some of which they took, some of which they didn't. If you begin with home grow and cannabis social clubs, I think you allow that home grow and social club culture to establish and grow and embed itself. And then if a regulated retail market follows down the road, 2, 3, 4 years down the road, you've already got a significant proportion of the market will be covered by home grow, and you allow those non-profit models to embed and thrive, so that when
you also allow them to transition.
Dominate. So that is part of the pushing back against the corporates, is to allow these non-profit home grow, slightly informal elements of the market to prosper and embed, and then you have a retail market. But you also would put controls around that in terms of corporate capture. So you would only give each, you would limit the number of licenses any one producer or vendor can have, for example, or you would limit the percentage control of the total market to 2% or 3% or whatever was determined to be. So you wouldn't allow monopolization of the market by corporate interests. You just simply design your market architecture so that can't happen.
What about vulture investment, sort of, because that's a way they've got round regulations before. So like someone like BlackRock, they just buy the 20 companies that make up a market, and each part of the company, like they become majority shareholder through investment in the 20 companies that own that market, and they then circumnavigate that sort of thing.
There are ways to monitor and enforce against that. You have to be vigilant and prevent that from happening.
Because companies like Curaleaf, Trulieve, or as you mentioned, like Tilray, they've just bought another 5 beer brands off Moors. Not Moors. Coors. That's the one. Thank you. That's why I was so confused as to why both words were in my head. Yeah, and so that, or like not Afaria, the other A one. Aurora in Canada. They are one of Canada's now largest craft flower cultivators. They're diversifying their portfolios to try and protect against the thing. Yeah, their model is basically to outweight everybody else and then own the market. I agree. I think it's a wonderful idea, concept, and I think you're entirely right. I think one of the other reasons to embed that culture first is to put passion above greed. So then the people that are involved in it, you'll get your wage and you'll live and whatever else, but you'll not be able to get your Bentley and your second Rolex and go to Dubai, or you'll be able to sort of, and it'll grow with the size of that market. But if the restrictions say in Germany of 500 people per head, you're only allowed X amount of product, those sorts of restrictions, I think, even with the time frame, mean that when the corporates come, they're not going to have quite the same restrictions. They'll rally, like you said, and use their money incrementally. So it'll start with these are the restrictions, and then in 2 years, 5 years, 10 years, like they'll use their influence to open that market. And unless there is legal protection, and this is where I always advocate for the full decriminalization of all cannabis related offenses, just tear the fucker up, because then once that is gone, anything else, you put the new law on top of it. But if you leave that old law, what's going to happen is the individual, say in Germany, like Germany right now, there's a massive rise in the far right. If that sort of political thing continues with the cannabis thing, if there's a bunch of leftists in that John Ehrlichman quote style that are in a cannabis club going, how do we combat the Nazis? Sorry, guys, my German listeners, that was terrible. But how do we combat like the Nazis? How do we deal with this rise of fascism in our country? And the police raid it because the club had one too many fucking plants, or, one person was in possession of 70 grams instead of 50. Like if we allow there to be a point of exploitation in the law, it will be used. If it's not used today, it can be used in the future. And I think,
but that's where you need very carefully drafted legislation. And if you look at like Malta, for example, and we were involved in drafting that legislation, it's very, very carefully written. And the bits that aren't in the legislation are certainly in the kind of rules and regulations produced by the Association for the Responsible Use of Cannabis, which is the government body set up by the legislation to oversee the non-profit associations and the home grow. So I think they are quite good. Everyone should go and have a look at the ARUC.mt website. It's and read about the multi-model. It's not perfect. There are some. People will go, well, that's too restrictive, and I would probably agree with some. It is too restrictive in some ways, but I think it's better to start a bit too restrictive and then relax it than try and do it the other way around. Because we've seen that with alcohol and tobacco, where you had woefully under-regulated markets who could aggressively advertise to children through sports sponsorship, or tobacco was sponsoring the Olympics relatively recently. Alcohol brands still
on Ferrari cars like 15 years ago.
Alcohol brands still sponsor football and sports, and Risley still sponsor music.
They still sponsor Formula One, but they're all there's some, I can't remember the name of the beer company, but they literally made a zero alcohol beer just so that they could get a motor racing sponsorship contract, because they can say, look, oh no, you drink this is non-alcoholic.
Right. So that whole brand extension into zero alcohol beer is a classic classic corporate wheeze to continue to promote. The idea of advertising alcohol in Formula One is so extraordinary and bizarre when you think about it. High speed driving with crashes where people die, advertised by alcohol. It's so weird. But
like McDonald's in the Olympics,
it's completely normalized. But we wouldn't want cocaine Premiership football or ecstasy World Snooker. Those things would be
no. Which one was it? Which was Steve? Was it Steve Davies came out and said he wanted to do a snooker competition on drugs? He literally came out, and then about a year ago as well, there's a billionaire in America who is trying to set up the dope Olympics.
Right. Oh yeah. I saw about that. So I don't mind people making money off cannabis businesses. I don't even mind people becoming millionaires. I would worry if people were becoming billionaires. Basically, you don't want billionaires, and there are some. The people at the head of Curaleaf and so on are cannabis billionaires now.
Boris has just come back to take the lead in Curaleaf, so it's going to be interesting to see what happens with their
people like Boris, whatever his name is. They are, to my mind, they are bad actors, and they should not be driving policy. It should 100%. Be grassroots organizations, people who use cannabis, public health experts, people who have the expertise in regulation, in farming, in public health, in child welfare. But just to go back to one of the things you said about, you think all cannabis offences should be decriminalised. The problem with that is something I was alluding to earlier. It's selling cannabis to kids should be illegal.
Yeah, but that would then, I wouldn't have that. I wouldn't have that under a Cannabis Act. It would be like,
or selling weed, contaminated weed should be illegal.
But under the alcohol license, as a 5-year-old, I could drink alcohol in the presence of my parents. That's written into legislation.
I know. Yeah.
Do you know what I mean? No, so,
or is it ridiculous? I don't know. Maybe it's not.
It's not though, because then if you actually look at the evidence of it, it's all anecdotal, granted. But there is an evidence base for people that were exposed to alcohol at home, had it demystified and de-tabooed. So they weren't doing what I was doing and sneaking into pubs at 15, 16. Do you know what I mean? I think the same thing is then true. The people I know whose kids, loads of activists whose kids, they're activists or parents who fight for cannabis or other drugs and consume drugs around their kids. None of their kids consume drugs.
Yeah.
It's not a thing. And that's the ultimate argument, obviously, for ending the war, is ending the taboo of it just being something. We know in America, we're looking at the statistics there, youth consumption's fallen off a cliff. Nobody wants to smoke weed because my dad smokes weed. It's not cool. They all want to do crazy shit. And we're ending up with this ever-evolving market that I feel like a lot of the work that we've been doing, no offense to yourselves or others that have been doing it for so goddamn long, is the world has moved so fast, and a lot of the models we're advocating for are 10, 20 years almost out of date, because the consciousness of the public has moved forward. Granted, like you said, the upper tier of the political class hasn't, but the investor class, like I said, you can go get $6 grand ketamine infusion in this country now. Do you know what I mean? You can sign up to DMT trials, you can sign up to MDMA trials. Yeah, some poor lad dies from complications of MDMA at Boomtown last weekend.
Right, but we've got, the thing is that when you're coming to something, the thing about cannabis legalization and drug law reform more broadly is it gives us this amazing opportunity almost godlike powers to design a new market and the architecture of that market and how it works and how the regulatory system works and how it interacts with the different interest groups from scratch. You literally have a blank slate. You have all these actors out there, all these chess pieces on the board. We get to design the model that we want that works in our interests. So once we've decided what our interests are in terms of crime reduction, public health, social justice, etc., you get the people around the table. You do, and this is what we've done effectively. We workshopped what the model or the models operating in parallel that we think will cater for the different needs and interests and deliver the best outcomes. And we get to design that, and it can include what you might see as sort of anti-corporate or not anti-capitalist, not the right word, but things that mitigate against the risks of commercialization, corporatization, monopolies, and that sort of the worst elements of sort of a neoliberal capitalism. You can mitigate against those in your policy design because we have this opportunity to do it from scratch. And if you need evidence that that is possible, I think the equity programs in places like New Jersey and New York show that you can, even in the kind of heart of the homeland of free market libertarian economics, they have got these systems where 70% of the tax take goes into social programs for disproportionately impacted communities. If they can do it in America, you can do it anywhere.
I know it still bothers me though. They get to determine who gets that 70% of money. Who are the disadvantaged people? It's not a self-identification thing. This is the argument we had in 2017 when we were supporting the law reform around prescription access. Is we wanted home grow, right to self-identification, and effective decriminalization for patients and collectives. So that basically, if this person's too disabled, they can nominate somebody to grow for them, or they've grown too much, they know another patient. Create these insular systems of access. And what we got is this corporate bastardized model where the majority of the players, again, no offense to Big Nasty or to the Plug and Jack and that, but they're now medical clinics. Like it doesn't make sense. Like you said, the merger of this, it doesn't seem that the legitimate direction of access for medical is happening. It is just this corporate greed. And I think that if you see how fast that can get captured by that in this country, I just don't have that much faith in a system that is titled as legalization.
Well,
and maybe it's the argument of the language, because my main point is that no drugs are illegal in this country. None of them. They are inanimate objects. They're incapable of criminal intent. They cannot be put in a court, fined, and put in a cell. It's only human action with them. And for then any system that we put in place, and as you said, we design it, if we miss why is there loads of people outside of this model doing stuff? Then we've done it wrong. The model has to include everybody. That includes, frankly, self-destructive behavior. I took a lot of drugs in my early 20s that people would be like, what the fuck? But in doing so, I was able to find myself. I was able to heal and deal with trauma of an incredibly abusive youth. I was able to reconnect with people in ways that I wouldn't have got access to. I've been through therapy most of my life, in and out of psychiatric offices, psychiatrist offices, etc. But the way that the drugs could help me in this self-guided thing, and to others it may look self-destructive, but I knew my tolerances. I knew I didn't want to harm myself. I knew the safety. I knew the risks. And it's in the same way of like, Rufus Hound tells an anecdote in the documentary Culture High about a woman in his local town who would eat 2 double boxes of Krispy Kremes every day, and she would buy them and sneak into the woods to eat them. And like we that's an allowed behavior. We can go, well, you're destroying yourself, you're going to kill yourself. And we're now at this point with smoking and tobacco where I feel that that's the new Prohibition 2.0 wave. And yes, it causes harm to public health and whatever else, but so does so many other human activities. We were allowed to jump out of a plane and all you've got to do is sign a bit of paper. If you then die, it's like, well, you died. Like, do you know what I mean? And I just worried that if we then have if we're trying to create a model that stops any potential risk in the future, it limits the potential freedom of others. I want to live in a world of car crashes. I know that sounds crazy, but I want to live in a world where I actually control the vehicle. I don't want to just get in a tram and it move around, because then it loses the meaning and the value of the thing.
You're touching on one of those really, really important debates within drugs and a lot of wider policy areas, which is the balance between state intervention and personal freedoms when it comes to protecting individuals and communities. And it's really, really difficult. And wherever you draw the line, there will be people who object to it, and there will be people on either side of it where sort of injustices will happen in one way or another. So if you make it too, if state intervention is too intrusive, you may protect some people, but you will also harm people by impinging on their freedoms. If you put it too far to the sort of libertarian direction, some people, maybe vulnerable people, won't be protected when they should be. So, it's all very well saying we shouldn't have limits on cars, but it's not about me driving safely. It's if someone crashes into me on the fast lane on the M4, I need protection. Arguably, I would need protection from that as well. And I don't think there's no scientific answer to that. These are political questions that need to be decided by a democratic country. And for each one of the questions that you approach when it comes to designing a regulatory framework, you have to balance up those conflicting interests between personal freedoms or community freedoms or freedom of thought and belief and practice with the responsibility of an elected government and a state. I mean, we can argue about whether we should have a state at all or whether we should have a kind of anarcho-syndicalist future or whatever. But while we have a government that's elected to do certain things, including protect the public from certain risks, they are going to have to intervene in markets and to a certain extent intervene in our private lives. The pub shuts at 11 o'clock. Oh, that's interfering with my freedom to drink at 11:30. Well, it is, but
isn't it?
We can have a debate about all of those things.
You could then go to the shop and buy alcohol on the way home, and so there's means in which you can circumnavigate these things. I mean, there's quite a few pubs will still do lock-ins. When when we were in the finals, the pubs were magically within 24 hours allowed to open for an extra 2 hours.
Right.
And see, I get what you're saying, but there's peripheral infrastructure for all of these things. What came to my mind a minute ago. I wrote a piece recently for Weed World. Didn't mean to plug myself here, but for some reason I got stuck in the idea of comparing the introduction of the automobile in America and the creation of criminalization of drugs. So basically, the 1906 Poisoning Act, Food and Poisoning Act, that led to the creation of the FDA, was 1906, and around 1900 we started to get major amounts of automobiles. The uptake just slams. So I think I'm going to butcher these numbers because I can't pull the piece up in my head. But it was basically when the cars were first introduced in around like 1920, it was, I think, 33 deaths for every 10,000 cars. And then through all of the interventions, the creation of seatbelts, the creation of shatterproof glass, the creation of one-way system, like the roading systems give way, the writing of the rules, the introduction of all of these things meant that as the cars got faster, a vehicle could not travel past like 60 miles an hour. It was just, that was like ungodly. Even like 40 mile an hour in the first vehicles was fast. And they were deadly because if you just went over a bump, the screen would shatter and it'd tear you to shreds. There were so many faults with the activity, yet it was a growing activity. There was about 200 miles of roads in America. Cut to now, through all of this, cars are now infinitely faster, some capable of 200 plus miles an hour. Right, the mass production and mass adoption of it by hundreds of millions of people in that country and X amount of miles. Through the input of the governments over a century, driving statistically in America became 98% safer over 100 years.
Right,
drug use, on the other hand, in America, through criminalization and everything else, I think became 2,800% more deadly. So
one of those things we regulate the hell out of, i.e., cars, and one of those things we don't regulate at all.
But we allow the cars to get faster. What I worry about is that with these regulatory systems, if then as we're seeing now, we're going to go, oh, cannabis because of James. That's not one name I went to pull out my arse there. Professor David Nutt, the idea of skunking like somehow 16, 17% THC. We've got to cap THC. Yeah, but there's now plants producing 30 plus. So if we suddenly capped cars at 100 mile an hour, but companies were still producing cars that went 200 miles an hour, we'd have a real big problem with people driving 200 miles an hour cars on the roads that are only designed for 100 miles an hour. And that's what I think we're seeing with, if we create these legalized and limited systems that are not robust enough to react to this, because it's not just the classic drugs that we all know. We've now got, the alphabet drugs that came in that, some of us have adopted and we can deal with this and that. But this whole other wave of synthetics and analogs and left-handed molecules, it's an insanity. All of that is that consequence of prohibition, but they now exist now. And if we just regulate this stuff that we want and we ignore all this other stuff, I can't help but feel like we're just going to end up with these same problems. We've accepted these ones, and it creates a drug exceptions. I'm not now advocating for crocodile or something like that to be legally available, but if it does exist, we have to then kind of worry about where
Well, I mean,
that's
you know,
going.
if,
And I don't think we should criminalize that per se either. So we have to, like I was saying, almost assess that, yes, when reckless youth, you probably could take more ecstasy in your 20s than you could in your 50s. Do you know what I mean? Just because of your heart and other, just degenerative things of being of aging. So we almost need to not incentivize, but create that map of where drugs are safest for people and
yeah,
allow that thing. We all talk about there's a time and a place for it, and it's called college, and everyone can experiment and whatever. Like there's that, and again, that's the classist paradigm. Whereas the council estate kids taking some pills and drinking some booze down by the river or whatever, going to get targeted. And so
yeah, and I think,
there's
you know,
these elements that I don't know how to like
it's
align in my brain. You know
well,
what
it's
I mean?
complicated. I mean,
Massively, massively, yeah.
and that's why our book's 400 pages long, because these things are complicated, and you have different sets of behaviors associated with different risks amongst different populations with different vulnerabilities and different costs and benefits, and you have a whole series of different regulatory tools at your disposal at each part of the supply chain in the market, from production through to availability and use. And it's complicated. You have to throw it all in the pot and try and come up with some proposals that meet the needs of as many people as possible and deliver the best outcomes we can for as many people as possible. Understanding that there are different interest groups and different stakeholders, and their interests are sometimes in conflict with each other. So, I mean, take, for example, the classic example of like tobacco tax. So the public health people are saying, we'll ramp up tobacco tax because we know that dissuades use. And it does. The more expensive tobacco is, the less people use it. We kind of know that basic supply and demand stuff. And as taxes increase, use goes down because people moderate the use because it's more expensive. Now, you could argue, well, that affects poorer people more than rich people. That is true. Anyway, that's something that public health people have long advocated for, and has happened arguably successfully because tobacco use has been going down for decades through other regulations and controls. But then if you over-regulate something like tobacco, or the price goes up too high, then the police are coming and go, actually, you're incentivizing smuggling and counterfeiting gangs to bring this stuff in. And about a quarter, 20% of the market for tobacco is informal smuggled or counterfeited tobacco products, because there's an incentive to do that because the tax is so high, because of public health. So you've got conflicting interests, and you have to strike a balance. And there is not everyone is going to be completely happy. There is a compromise to be made, and we have to decide democratically, and policymakers looking at the evidence, where that is. But we also have to be flexible. We have to say, okay, we've put in place this tax level or this particular regulatory intervention. Is it working? You need to monitor and evaluate. And if it's not working, you need to be willing to revisit it and review. And policy has to evolve with the changing times. And you're absolutely right. Drug cultures and using cultures change through time. You know, there are trends in new drugs. There are fashions driven by music or culture or demographic change. And policy has got to be flexible enough to appreciate that and adapt and respond. Look at what the outcomes are from a particular policy intervention or cluster of policy interventions. Say, you know, this is working really well, let's push on with that, or this isn't working well, we need to either take a step back or try something else. You know, policy has to be able to evolve. We mustn't be dogmatic about this. You know, I hope that what we are proposing, what Transform is proposing around this new Legalise UK cannabis campaign, is a broad, multi-tiered, flexible model that meets the needs of as many people as possible. That's why we have home grow provision. We're proposing home grow provisions. We're proposing cannabis social clubs, and we're proposing a sort of equity, responsibly regulated retail market alongside a medical model. And I don't know. I mean, I hope people will see what we're proposing and buy into it and get behind it. It feels like we have a moment. We have an opportunity in the UK. Because of the reforms sweeping around across Europe and North America and elsewhere around the world, the environment that this debate is taking place in has changed. It's much easier to talk about cannabis regulation when you can point to Germany, or you can point to Canada or Malta or Uruguay and go, look, they're doing this, and look how much tax revenue they're getting. Look, youth use hasn't gone up. Look, the products are safer. Look, you know, you can point to these things and you know, look, we have regulated markets, we have equity programs, we have businesses doing well, we have economic activity that's legitimized. And it's not just that the international environment has changed the debate in the UK. We also have shifting public opinion. We have a demographic shift where more and more young people are coming of voting age, more and more older people who, with all due respect, are dying off, who didn't support it. You have a demographic shift in favour of regulation. The wind is blowing very much in one direction, and we've got a new government who aren't very supportive of drug law reform or cannabis reforms, but at least they are. There's an opportunity there. There are clearly people within the government, like David Lammy, who's been very open about support for legalisation in the past, is now, one of the big four. He's a foreign secretary. Keir Starmer, who's been very hostile to cannabis reform, but he was a prosecutor. He must know intellectually the arguments. And they've got time on their side in a big majority. It feels like there is space, at least, for an intelligent discussion, probably starting with decriminalisation that could then evolve of possession, that could then include home growing, that could maybe then include cannabis social clubs. And you're setting the scene for a tiered market that included those and a regulated retail market at some point in the not too distant future. So it feels like various planets are aligning to allow for a more intelligent, informed discussion around what cannabis regulation in a post-prohibition world would look like in the UK. And I think that's why Transform has decided to have this initiative and this campaign and crowdfunder now, because we've been working with all these other governments around the world, helping them design these regulatory models based on our work over the last 20 years. Many of them are now in place. They're delivering, they're working, they're successful, they're generating tax revenue, they're reducing criminalization and the burden on the criminal justice system, so the police can go and worry about actual crimes instead of made up ones. Things are moving, and it feels like it's the UK's turn, and the political environment is ready for it. So you can see with people like Sadiq Khan in London, for example, support for legalization nationally is hovering around 50% now. In London, it's 60-65% support for legalization of cannabis. And that at that point, when you clear that kind of majority into a majority, you create a space where support for a cannabis reform platform is a political asset rather than a political liability. And at that point, change starts to happen, not just a public discourse or a media discourse, but in the political discourse as well, because politicians can see the advantage. They're eyeing up those tax dollars. They're eyeing up the crisis in the prisons and the criminal justice system. They're eyeing up the young voters. Because most politicians are cynical. They care about money and votes and power. And if cannabis reform starts to look enticing on that basis, then we would hope that they would show moral, principled leadership, but often they don't. But if it works, then politically, change starts to be possible. And if you look at the US, it was when you started getting majority support that change started to happen, because ballot initiatives became a viable, trajectory of vector for change to happen. And I think we're getting to that point in the UK. And so I think the reason Transform have sort of stepped up their UK activity with this new campaign is, now the debate is moving beyond, is the war on drugs working? Yes, no, clearly it's not. Is reform needed? Well, clearly, yes. We're moving to the point of what would responsible cannabis regulation in a post-prohibition world look like? And I feel that that's where we have some experience and expertise, and, we've done the work to help map that out and to help that discussion, inform that discussion and make it happen. So that's what we're doing. And I really hope that, you and your listeners can get behind it. I'm not saying everyone has to give us loads of money for the crowdfunder, although you are obviously very welcome if you have any. But just to get behind it, to read what we're proposing, to talk about it, to take it forward, to sort of support it in your peer groups, in your professional arenas, online, in your Reddit groups and whatever. It's really important that this conversation continues to build, and we are hoping that our work can inform that in a positive way.
No, I agree with everything you've said. My issue still falls back to, I guess, the nomenclature, the terming of it, in that I know it's incidental, but this is going to sound very esoteric about English language. The fact that it is the first word in a sentence means that it's capitalized, just because if it's in the first word of a sentence. Whereas legalization small L is different to legalization big L, is what we're seeing in terms of legalization big L in practice for the past 15 years has meant that corporate takeover that we've been speaking of. And so my literally only hesitation of it is because of the legal fallacy that is created there. That legalization cannot exist because to legalize is to make something that was previously illegal legal. And cannabis and all drugs are not legal, illegal offenses. They are lawful, unlawful offenses. You are found in unlawful possession, unlawful supply, unlawful, etc. And it creates this kind of false paradigm in the same way of what we're seeing now with people calling other humans illegal, which is a fallacy. It doesn't make sense. The only thing you can state is about lawful right to remain. That's all it is. Everyone is legal. There is no way for a person to be illegal in the same way as a drug. And so my only hesitation there is again is of the language of the only way I can make it make sense in legalese and conceptually in reality is that it has to be the decriminalization of offenses because it's removing the criminal sanctions of these things, or descheduling of drugs where the drugs are removed from the scheduling, which automatically removes which if you did that as the initial mechanism and then this legalization, whatever we call this new regulation model went on top, I think that can work. But I think the gray area that's left between the legacy legislation and the new things that you're proposing still leaves an incredible amount of space for classism, an incredible amount of space for like this postcode lottery and this like London-centric attitude that we're going to see, that we're already seeing, frankly, around cannabis investment. You know, in 2020, September 2020, macro solicitors were involved in basically bullying the Financial Conduct Authority into allowing so-called medical cannabis companies to float their money on the London Stock Exchange. I think there's something like 70 million currently stashed away there. So the systems that it's going to create, I know we've discussed this for basically 2 hours, but my hesitation is that the language has become oppositional and an artificial binary in the culture. I may have played a part in that because of, again, the interpretation of the language is that legalization feels like a corporate interest thing.
I get that.
It's for what's coming, whereas decriminalization feels like we're going to help you with what is and what's been. And so the last point about this I wanted to clarify is, are you advocating for expungement of records and for restorative justice in that way?
Absolutely. And there's a chapter in that in our big 400-page boring book. There is a chapter on expungement. There's a chapter on corporate capture and how we mitigate against it. There's a chapter on equity programs and social justice. Please, people, and we blogged a lot of those chapters on the Transform website. So you don't have to wade through the whole book. I totally get your point. I think decriminalization and legalization and regulation are not very well. They're often used interchangeably in ways that it's quite confusing. Decriminalization I see as removing criminal sanctions from a particular offence. It's usually around possession, but it's sometimes around personal cultivation or small scale supply. Usually. But these things aren't defined in law, by the way. Decriminalization doesn't appear in any law in the UK. Legalization generally, the problem with legalization is the process. So something that was an activity that was illegal becoming legal in some way. The problem is because it's a process, it doesn't really speak to what happens after that process, and that is where regulation comes in. So we often talk about legally regulated markets, or legalization and regulation, or legalization and that facilitates responsible regulation. Because the problem with regulation is regulation isn't a single thing either. It's a whole spectrum of things that can go from state monopolies all the way through to complete free markets.
So that's
where all the questions is, and that is where the focus for us is. After a legalization process, where do we land? What follows that legalization? What regulatory market structures do you put in place after the legalization process? Where does it lead? And for us, that is where the focus is, both with cannabis and with work we've doing on other drugs.
Just to clarify that in a second. So again, for clarity's sake, I am diagnosed ADHD and I am currently being investigated for autism, which might explain why I'm struggling with the conceptual idea. I'm struggling with the very definitive nature of the terms here. But so a transform actually, by legalize, you're not stating that you want to legalize cannabis, which is then the lawful fallacy. You're saying you want to legalize as in reverse the criminalization of the offenses committed in relation to cannabis.
Yes, partly that, but then we also advocate for a legalization process towards a regulated market, and then we say what we think that regulated market should look like or how those regulations should function.
So basically, I think what's happening in my head.
Legalization is a process rather than an endpoint.
Yes, I get it's almost like it's secondary and third definitions within the same sentence. So
yeah, and it's confusing because
yeah.
you know, I think if you just use legalization on its own, it does leave it open to misinterpretations about crack dispensers in primary schools and all of that, some of those sort of misnomers about completely unregulated free markets. So we generally talk about legal regulation or legalization and regulation, or we just don't talk about we don't use legalization at all because, as you say, it does leave it open to unless you then account for what legalization leads to. People's misconceptions will fill that gap. So we talk about legalization regulation or legal regulation or legally regulated markets, and then we hopefully it's quite difficult on Twitter and social media, but then we try and say what we mean by that. And in the case of cannabis, it's home grow, social clubs, the responsibly regulated, equitable markets, and all the rest of it as spelled out in our various literature and blogs and whatnot. So it is complicated. It is complex when you're going into like tax and packaging and licensing and all the details of regulation. It can be quite difficult to boil it down into sort of soundbite sort of Twitter type messaging.
Yeah.
I hope we try and do that, but it's not always easy. So people can take our top line messages, or if they want to dig into the detail, it is all there. Everything we produce is made freely available on our website. And it's that detail where I think we have distinguished ourselves from a lot of other actors in the cannabis campaign market, that we've done the regulatory scholarship, the boring desk-based. I've spent years doing boring desk-based research, talking to people, talking to experts, traveling around the world, working with governments, working with this, that, and the other licensing bodies and so on, to come up with these models, which I hope people will get behind or at least discuss. You see, that's where we need to, if people are discussing, they're like, well, I agree with you on that, but hang on, what about this? Your plant limit or your packaging or your potency controls or your licensing models. I think that's not going to work here. And that is where the discussion needs to be. And we're not dogmatic about it. These things aren't written in stone. If you look at the 3 editions of our cannabis book, it's evolved. Some things have changed. We've moved away from certain positions and brought some new experiences and thinking to bear. It evolves as it should. Legalization isn't an end in itself. Like you say, the end in itself is the public good. It's the health and safety of individuals and communities and including the whole global community. It's not just about I'm not a sort of ideologue. We must legalize all drugs because I'm a sort of free market libertarian or anything else. There's lots of reasons why you'd want to do that cover lots of different areas, whether it's health or crime or social justice, human rights, sustainable development, whatever. But we're trying to balance all of that and mix in all of that complexity about what it means in practice, and then produce kind of simple soundbite arguments that can get out there into the wider public. Because not everyone is as interested in this as you and me or your listeners. We are your listeners by their nature, people who are interested in this topic and have an understanding and expertise in it. A lot of people who just reading the Daily Telegraph or the whatever, the Evening Standard on a bus, they don't know about all of this stuff. They haven't really thought it through. We have to inform and guide that process so we can incrementally change public opinion, as we have successfully done for decades and need to continue to do, because we are now at that point where change has become possible. And the fact that we're at 50% support for legalization of cannabis without either of the major parties or any really major news outlets getting properly behind it is a testimony to the fact that, as an advocacy community and in all its diversity, we have won those arguments over the last 20, 30, 40, 50 years. It's not just the cannabis community. It's academics, it's intellectuals, it's human rights organizations. Amnesty International now supports the legalization regulation of all drugs. A lot of people don't know that. It's the biggest NGO in the world. This year, go and read it, go and find it. We tweet about it. We worked on it. I worked on it personally for the last 7 years with Amnesty International to draft this incredible document. advocating for a human rights-led drug policy globally that includes the legalization regulation of all drugs, and then goes into detail of what that means, including the definitions that you were talking about. The Office of the High Commissioner for Human Rights, the leading human rights organization at the United Nations, now advocates for the legalization and regulation of all drugs. Mm-hmm. Again, Transform and other actors within the drug policy reform movement have been very involved with that human rights body advocacy for years to get to that point. So you now have the biggest human rights NGO in the world and the biggest human rights entity in the United Nations call for the legalization and regulation of all drugs, specifically call to the end of the war on drugs and call for responsible regulation as a way of enhancing and protecting human rights, including the rights of freedom and belief and practice, including the right to health, including the privacy in the home, including a lot of the things that I'm sure you and your listeners feel very passionately about. So, we are winning the advocacy battles in these key institutions on the biggest stage possible. Global UN organizations, global NGOs, as well as at the grassroots level. So, but the grassroots stuff led to those UN institutions and those big NGOs taking those positions. It was grassroots advocacy that got us there, and it's grassroots advocacy in the UK that is going to get us over the line. I mean, that, and I hope that Transform, we see ourselves as a catalyst and enabler of that, to inform those debates and push those things forward and use our networks and in policy making and media and professional groups to take all that forward. And I hope that's why people will be interested in getting behind our initiative and crowdfunder.
Yeah, man. As I kind of said before, I think I mouthed before, I will include obviously all links below. I think you've won my support. I'll give you that, Steve. I mean, I've always kind of supported what Transform have done. I'm not saying I haven't, but it was just, I have such a visceral reaction because of what I've seen with the places I've gone where legalization has happened and the legacy people I've spoke to that were like, we stood outside of this building, we gathered these signatures, we did. And hearing these people and then hearing about the astroturfing that has happened of the grassroots space. I mean, the UK is, well, this, we are unbelievably corrupt. We think Cure Relief and that are bad actors, True Relief are bad actors in their various countries. We have some big boys and some very known people and some very unknown people that are working towards, I would say, ill ends that are not for social justice, restorative justice. They're not for the consumer or the betterment of the world. So I think you may have a little bit of an uphill battle, but yeah, I'm going to swallow my pride here. I'll share, I'll support. I will. I know it's my issue around the language, but I understand as well how language leads to the structural repression of certain groups in reality. And can see that obviously my campaign is, I'm still youngish. I'm in my mid-30s. I've got till I'm 70 to do this. So if we get legalization out of the way, then we can figure out all the libertarian freedom stuff after. As long as somebody's access isn't predicated on somebody else's criminalization. That's the only thing I worry from legalization.
See, that's a nice soundbite there.
I'm pretty good at these soundbites. This was the thing I was going to advocate for. More stakeholders from the legacy culture in the UK. I'm not sure who you're working with, who you're speaking to, but speak to more people. We're very fractured because there was a lot of misinformation. A lot of people literally were paying and setting up events and stuff to discredit others. Like there's a lot of shit has happened in the UK. And if you guys are really going to take the lead on this, start to speak to some of these people and they will give you grassroots gatherings again. They will bring people back together.
I really want to. I think I've talked about and we've written about a lot the broad brushstrokes of what we see a UK regulation and regulation more broadly at sort of international level as well. Legalization regulation would look like. The detail is has to still be worked out, and we do. I think the sort of cannabis community, if you want to call it that, has a really important role to play in bringing their experience and knowledge to bear on shaping that. They're not the only people at the table, but they are a very important part of that. And we do want to hear from people about how they see regulation, not just what the endpoint vision is, but how do we get there? What are the steps? How do we protect the interests of the different people? Not everyone is going to agree with everything that we come up with. But this is it's a continually evolving debate. These things are not cast in stone. But but as I said, compromise will be needed. Not everyone is going to get everything that they want, because there are different stakeholders, and they all have a right to chip in on this. And sometimes their goals and priorities will clash, and then you need to have compromise. That is part of the lot of the policymaker as well, is dealing with imperfection, dealing with suboptimality, dealing with conflict, and making sure compromise can move forward. I hope we're getting there. And Transform we are an actor in this debate. We're not the only one by any stretch. There are lots of other cannabis campaigns. There are lots of other drug policy reform outfits. There are lots of other human rights organizations, for example, and harm reduction organizations, and treatment organizations, and police organizations, and health organizations, royal colleges of medicine. There are public health bodies. They all have a part to play in this. And if we can inform and convene and enable that debate to move forward in a positive way, and we can thrash out some of these tricky questions, great. And I am optimistic, given what's been happening around the world, the possibility of change in the UK, whether it will be in this government or in the next one, whether it will be next year or this year, or what those steps will be. That is all to play for. But the more support we have, the more resources we have at our disposal, the quicker we can make the much needed reforms happen. So please do check out our stuff, get behind the campaign, support us, because it feels like change is possible now, but we need you all to help us make that happen.
Yeah, and I hope people will obviously follow through with the links and share and support. I think it's difficult because it's taken me 2 hours to go, all right then, kind of thing. I'm not saying I'm like the highest authority or whatever, but I know a lot of people will do a similar thing, or another legalization thing. That's why I put the comment on that I think it was Esther responded to, which is why we finally arranged this conversation. I'd be like, well, is this just going to be another cash cow for corporations? And the response was eloquent, articulate, and bang straight to the point. I was like, okay, fair one. So I think this is, the more you can have this open communicative thing with, because again, I agree that there are all these stakeholders, but there's only some of these stakeholders whose door is going to go in tonight. There's only some of these stakeholders who are going to get pulled over and lose their license and their job and maybe their kids. And so I'm not saying they deserve more, but it's in the same way when we had the consultation around the elimination of the criminalization of homosexuality, nothing about us without us.
Yeah.
You know what I mean? It's and we've seen the wonderful things that queer culture has then given to humanity in terms of the arts, poetry, music, theater, all the rest of it. It's literature, etc. I want to see what the drug consumers can give to the world when we're truly allowed. Not just that, oh, he's rich, so he's allowed to do a bit of drugs, with Khalifa and getting caught with his joint in Romania and basically getting a thank you and told to leave. You know what I mean? I want to see that erasure. And I think what you're proposing sets the foundation that may be a little shaky, not because of yourselves, but because of the history of the world that we're going through, the time we're going through. But if you are willing to work with that, I'd say the majority stakeholder, which is the legacy consumer, then they will have your back as long as you listen and hear their concerns, because it is such a diverse, unbelievable group of people. We peg it at 1 million this, 1 point this, whatever, but you'd be surprised. Like, we look at music festivals, we know a lot of people like to take drugs, but as you say, people don't take them every day. But we have to include all of those people in that conversation to create the best outcome for all parties, and the recognition, as I'm slowly coming to, that, as you say, it's the first step. It is not the final one. It's the signing of the ceasefire. Then we figure out the reparations and the reconstruction after the war.
Great. Yeah. Well, I mean, genuinely, it's great to hear you say that. And if we have disagreements on things, I suspect they would be over detail, and they're things that probably you sit down, you work it out, you come to a compromise. I mean, that is what policy making.
It's just seeing each other's point of view, really. And this is all about this honest conversation. This is why I started this podcast, is I wanted to have these conversations publicly so everyone can know that none of us are monoliths. So none of us are, like you said, dogmatic ideologues. Some are, granted, okay, yeah, some people are. I have been many years ago. But meeting enough people, going around the world, traveling to different locations and seeing what this actually is, and having the humility to recognize I can't speak for everybody, nor should I.
No.
And I think that's where, this kind of conversation is hopefully going to be very impactful to individuals that may have been very, or just dissuaded by the nature of the campaign because of the language. So I do hope many of my listeners, have come to
I
the same
mean,
realization I
I
have.
mean,
Yeah.
like you say, even within what you might broadly describe as the cannabis community or the cannabis activists, there are lots of disagreements on lots of stuff. So it's, again, even if I was only talking to the cannabis community, and I'm not, we're talking to all kinds of different stakeholders across different institutions and blah 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 interests. But even if there's just talking to cannabis, you're still not going to get everybody happy because
Yeah.
they don't all agree on everything, and
Yeah.
it's yeah. I don't, so, but I think there's a bit of a danger, particularly with social media, where people can become kind of very polarized or reactionary, or if
Mm.
things aren't exactly what they want, they go, kind of gotcha, you're a bad actor, you're doing this,
Mm.
or you're representing such and such. It's kind of like people have got to take a little bit of a step back, be a bit more open-minded, understand the nature of multi-stakeholder policy-making debates and processes. And I hope we can earn people's trust. Transform can earn people's trust that we are good actors, we are listening. We can't please everybody all of the time, but we are doing our best.
Mm.
And yeah, check it out. Follow us on Transform. Follow us on Twitter. Read our stuff. Visit our website. Check out the crowdfunder. Just get involved. It is really, really important. These things don't change on their own. They don't change just because Transform says something. It has to involve community. It has to involve the grassroots. In many respects, you are the people who are going to drive this forward ultimately, even if we're kind of, chucking little bits of stuff to enable and inform it along the way. So yeah, get involved. That's how change happens.
Excellent, excellent. I think I was quite concise with that whole legalization UK campaign. I think, like I said, I'm a supporter. Links below. I've got one final point of just some news related that I wanted to mention and have a quick discussion on, and then I'll let you go. Did you see the National Crime Agency announcement saying that it is now the most dangerous time in history to take drugs?
I
Um,
did. I mean,
Thoughts?
I there is an element of truth in that, and the reason I would say that is because it's because of prohibition. The drug market is becoming, as you've already alluded to, it's becoming more atomized and fractured. We have all these new psychedelic substances, the alphabetamines. Did you call them that, or the alphabet drugs?
Alphabet drugs.
Yeah, all these drugs that 3-MMC and 4-MMC
Mm.
and PCXYZ and blah blah blah. And there are hundreds. There's about 10 new ones being identified every week by the European Monitoring Centre. And when those things, particularly around pills and powders, um, are so unpredictable, and the incentives on an illegal market to adulterate or missell or unknown potency and contents of things that you're buying in pills and powders in particular, it does make them more dangerous. And the particular risk is around synthetic opioids, so nitazines and fentanyl, which are starting to creep into particularly the opioid market. Sorry, the sun's just come out.
That's all right. Just getting the
Um,
glow of God there.
particularly these synthetic opioids, which are like 50, 100 times more potent than heroin,
Mm.
are starting to creep into the opioid market, making heroin particularly dangerous. But they're starting to creep into some other drug markets as well, particularly around things like fake benzos and fake
Mm.
Xanax, street benzos, and so on. Nitazines are starting to crop up in there, and they are just really, really dangerous. You take, if something is 100 times more stronger than heroin, you need like a grain of sand of that in a pill, and you can die. I mean, it is really, really dangerous. The idea that these things are cropping up in cannabis is a bit of a myth. They're not really in pills, in ecstasy or cocaine yet. I mean, it has happened in the US. I think a couple of cannabis vapes have been tested, illegal cannabis
Mm.
vapes on the UK market that did have some nitazines in, but I don't know how much. It was Wedinos tested that. Mostly it's a problem with benzos and opioids,
Mm.
heroin, with the synthetics coming in there. But generally, the prohibition, it does create perverse incentives that push the market towards adulterated products or missold products of unknown strength and purity, which are intrinsically more risky. So whilst I'm very wary of those kind of sensationalist statements like the National Crime Agency came out with, there is at least a grain of truth in there. But if there is a grain of truth, it's driven by prohibition and illegal supply. And the answer to it is, in the short term, it's harm reduction. So it's things like drug testing services like the Loop do in Bristol, but we need to be in every city and town in the country. It's about information and knowledge in helping people to make responsible decisions about their drug use so they can control their dosage and how they do it and if they've got particular vulnerabilities. And in the long term, it's about regulated supply, because you don't have, if something is regulated, it won't be adulterated, it won't be missold, you'll know how strong it is, and it will give you information on the package or at point of sale about how to use it in ways that reduce your risk and protect your health. No drug is completely safe, but they are all way more dangerous under prohibition, where production supply is through illegal supply. Regulation reduces risks. So yes, it's true. And I think there's data out from Scotland today about drug deaths. I haven't. There was the first news reports are coming on just before I came on the podcast. I hope we haven't given it away that what date this was recorded on, but drug deaths have gone up, are going up again in Scotland, and it's mostly to do with synthetic opioids contaminant. They are actually doing some good stuff in Scotland with supervised consumption and harm reduction stuff and treatment, but you can't fight it when the heroin market is being contaminated with synthetic opioids because of prohibition. Lots of people are going to die, and if those drugs start to contaminate and percolate into other elements of the drug market, lots of people are going to die, including young people on the party scene. So the need for harm reduction and ultimately regulation, legalization regulation of all drug supply has never been more urgent and important. And I don't want to need lots of people dying to make that debate happen, but it has to happen. And it's because the debate around regulation is not just about cannabis. In a way, you could argue that the more dangerous drugs, it's more urgent that they're regulated, because that is where a lot of harm is happening. But more harm is happening because of prohibition under heroin. People don't die of cannabis incredibly rarely, whereas people do die all the time from heroin, especially when it's contaminated with horrible synthetic opioids like nitazines and fentanyl. So yes, regulation of all drugs ultimately has to be part of the answer.
Yeah, I think I massively agree. Another point that we're seeing of just, it makes so much sense that it's a logical step for the dealers and producers, but it's not trickling down to the consumers. So pills are like 380 milligrams MDMA, and that's because if I'm going to take these 50 pills through customs, or I'm going to move these unlawfully, you know what I mean? I could put the same amount of MDMA in 10 of those, or say there's an arbitrary thing in Holland. I can't remember what it is, but during is it Dominator or one of the major festivals, there's generally a discretion. If you've got a couple of pills on you, you're left alone. Like there is just this tolerance of these party drugs at these events during those events. So then the incentive is to sneak those drugs in to sell them. If I then put 5 pills worth into one pill and get caught with 2 pills, I've got 10 pills worth, but 2 pills.
Right. And
so shit like that is just
exactly the same with heroin. If you're an organized crime actor, why would you bring in 50 kilos of heroin when you can bring in 1 kilo of fentanyl, or you can bring in a matchbox of car fentanyl, and it's the same money. Matchbox you could just put in your coat pocket, walk in, it's like 50 kilos of heroin. Prohibition creates these perverse incentives for the market to tilt towards the most dangerous, potent but profitable products. And it's the same with MDMA, it's the same with heroin. To a certain extent, it's the same with, I think there's even an element of that with cannabis. The fact that cannabis markets have tilted towards ever more potent strains, but also towards ever more potent extracts. I visited a place in Massachusetts, and they had all these extracts, and there was this stuff that was like white crystals, and I was like, what is that? And they said, well, that's just pure THC extract. It was like, and I said, how pure is it? It's like over 99%, and it looked like something out of Breaking Bad. And I was like, what's that for? What's the market for that? And they said, well, no one uses that on its own. Well, I'm sure some people do, but generally it was for making edibles. And I was like, okay, fair enough. But if you create incentives for the market to go towards that, potentially more potent products, whether it's cannabis or MDMA or anything else, will tend to be more risky. Now we can get into an argument about cannabis and potency, and we haven't got time for that because we've been blaring for 2 hours.
Yeah.
I've got to go and do some other stuff. But generally, you know, again and again and again, you can see how prohibition and the war on drugs makes drugs more risky. And it's not just for the users, it's for everybody, because it creates these networks of criminality that, you know, create violence and chaos across the world. So that has got to end, and the debate has got to move to what do we do instead? And that's where I hope Transform come in and can do something useful with cannabis and other drugs.
Okay, just one quick point that for clarify on the Legalisation UK campaign that you just made me think of there. What is then the approach to, because there's a big conflation in this country of, cannabis hospital admissions, and like 90% of them are synthetic spice and all of these synthetic cannabinoids. Where do synthetics fit into this legalized model? Is this something, because at the minute with the market incentivizes HHC and these other non-criminalized sort of products to then get in people spraying them on flowers. But in different markets, it depends obviously where you are in jurisdictions. People are then ordering a legal product from somewhere and then selling it in a place where it's unlawful to do so as a different product.
I think it's definitely the case that cannabis prohibition created the space and the incentives for the synthetic cannabis like spice and black mamba and stuff to emerge in the first place. That is definitely true. And they were then progressively criminalized by, you know, ACMD would do some research and ban one lot, and then another generation would emerge. And again, you can see how prohibition makes things worse, because the second generation synthetic cannabinoids were more dangerous than the first lot. And then the third generation, they were all banned. Third generation comes out, they're more dangerous again. And then fourth generation, on it goes. And they got so fed up with it, eventually they came up with the Psychoactive Substances Act, which banned all drugs for eternity. If they were psychoactive, they are banned by default. If that did anything good, and I'm very wary about suggesting prohibitions work, but if it did anything good, it did stop, to a certain extent, some of the HHC and Delta 8 type, the new generation of hemp-derived synthetics, semi-synthetics like HHC, which I think are made from CBD mostly, that is hemp-derived, and they're probably not as bad as spice and the fully synthetic ones. But we know relatively little about them. They haven't been properly evaluated for risks and potent toxicity and so on. But again, the space for those products to emerge only exists because of prohibition. And I think the best way to get rid of those markets is to regulate cannabis and cannabis-related products in a responsible way. And I think you could justify prohibiting sales of those products. I wouldn't criminalize anyone for having them or using them, but I think you can certainly. A regulatory system wouldn't allow people to just invent new cannabinoid synthetics and start selling them, not without a full evaluation of risk, which is quite an involved thing. So prohibition created that problem. Regulation of cannabis, I think, will significantly do away with it. There's no market for fake cannabis if you can buy the real thing in the same shop. No one's going to buy it. Spice is slightly different because it has now found its own niche within certain problematic user markets because it's very cheap. It's very accessible. It's used as a drug of escape in a similar way to heroin.
Dissociative,
amongst some sort of people who are homeless, people, similar approach to people who are injecting heroin. A lot of them are now using spice because it's cheap, and in prisons, for example, because it doesn't come up on drug tests. So it's very highly concentrated. It's easy to smuggle into prisons. A lot of prisons are using it, and people are dying. I mean, unlike cannabis, you can consume some of these products and actually die. So they are way more toxic, way more dangerous, way more unpredictable. But again, they are created by prohibition, and part of the answer, at least, is a responsibly regulated market. But cannabis will kill off the demand for a lot of those products, particularly the new generation HHC sprayed on flower nonsense, which, I would genuinely advise everybody to avoid all of that shit, not least because it's unregulated. You don't know what it is.
Yeah, no, I would agree. Stick with good old fashioned THC.
Stick with what we know. I mean, the THC and cannabis not completely risk-free, but we know the risks and we know how to manage them, and we know how to do that. These things are unknown, and you're taking your health in your own hands if you just using not just unknown products, but unknown products produced by unregulated suppliers. So you don't even know really what it is.
Yeah.
I would fully advise everyone to avoid all that stuff. And just to be clear, HHC, Delta 8, and all of those new generation of synthetic, semi-synthetic CBD, hemp-derived cannabinoids, they are all illegal. They're not illegal to possess because they're only covered by the Psychoactive Substances Act, which doesn't criminalize possession, but they are definitely illegal to sell or supply. So, you've seen these posters up around the countries where it takes you to a website selling that shit. Those are illegal operations. Don't be fooled. They are illegal. It's not legal to sell that stuff. In theory, it's not illegal to possess it unless, weirdly, you're in prison, where psychoactive substances...
Is there an assumption of possession with intent to supply under the Psychoactive Act?
There can be, yeah, there is that supply, possession with intent. It's a bit like under the Misuse of Drugs Act. Possession isn't illegal. Possession with intent to supply is illegal, and supply is very definitely illegal.
So it's the
how possession with intent to supply is determined, that gets into a more complex thing, which we don't need to go into. But if you've got scales and baggies and piles of money and a ton of that stuff, yes, you will get done for intent to supply, or you certainly could do.
Yeah.
Okay. So don't do that.
Yeah, no, thank you for clarifying and for giving us your thoughts on that. Thank you for taking the time. I'd like to invite you back later on in the year to discuss sort of how the campaign is going.
Oh, sure.
And yeah, I've thoroughly enjoyed this conversation. Well worth the wait, Steve. Thank you for taking the time.
It's been a pleasure.
Likewise. I'll let you go. I'll do some housekeeping and yeah, enjoy your time away, sir.
Right, take care.
All right, peace and love, man. All the best. Bye. Well, there you go, folks. That was Steve Rolls from Transform. What's the full name? Transform Drug Policy Foundation. Slipped my mind there. I really enjoyed that conversation. As we've sort of alluded to during the recording there, me and Steve have been trying to get a recording together for a couple of years. He's not quite my longest running potential guest. I think somebody is approaching 3 years of, maybe, hit us up in a couple of weeks, couple of months. But yeah, that was definitely worth the wait. Got a lot of time for Transform historically. Like I said, if you check out episode 34, you can learn more about Transform with its original founder, Danny Kushlik. I maybe had some misconceptions there about sort of Steve and his work, which quite quickly melted away during that conversation. Yeah, I'm aware that my history, my experience, and my trauma can make me quite guarded to individuals. But when given an opportunity to converse like this, it's a lot easier to humanize them and to be able to, clarify their positions. And I think, as Steve actually said at one point, because of the way social media and everything works, it's that whole what's the meme of like somebody going, "I like oranges," and then somebody responding going, "Oh, so you hate limes?" That kind of binary rhetoric that has emerged in social media spaces and online spaces has become quite toxic, because you can't read the nuance of somebody's facial expression, of their hand gestures. If you're lucky enough to be with them physically, you can, I don't want to say get a vibe, as the kids say, but like you can feel out where they're going with something. There's so much more in the micro non-linguistical expressions that when we can sit together like this and communicate, I think it's a lot easier to reciprocate a level of understanding and a real want to, hear the person rather than just assume what it is they're saying. But yeah, I thoroughly enjoyed that. We'll include all links below. I still have my trepidation about the word legalization. The clarification I've got in my head is that it's a small L because it's capitalized by the sentence instead of it being a proper noun, and thus under legalese a separate dictionary definition. I still have my qualms about legal, lawful, but it's kind of evolved my position, or I evolved my position in that conversation a bit on the idea that if legalization is the removal of then criminal sanctions on the individual rather than legalizing cannabis, is often the phrasing when you can't legalize cannabis. But if it is then to legalize as in to end the criminal sanctions on the individual, it's just, the language is poor. Do you know what I mean? This is what we kind of discussed there. You need a fucking sentence or a paragraph to say what you're meaning. It doesn't fit onto, one of these nice little placards. It's not a sound bite you can put into 3 words, you can smash into a tweet. Although actually, I think you get 500 characters on a tweet now, or 250, whatever it is. So maybe you get closer to it. But yeah, there's so much nuance And I think that, yeah, if that's their position and they are legalizing these offenses, I can deal with the what I see as the fragility of that language, because the intention behind it, as explained by Steve, I think actually as is touched on by Danny a couple of years ago when we had him in the podcast as well. Yeah, speaks to their intention. I think the fact that he is mindful of corporate capture. It's been a while. I think I read or perused the second edition. I might have a look at the ebook, which I'll include in links below, folks, for the updated version 3 and see where they've evolved their position. But I think Steve's been in this a good few decades. He seems like he's a lifer. You know what I mean? There's quite a few of us in this that are lifers, and I think his intention is to create a better world. And I think he does, as you said, they're not dogmatic. They're open to conversation. They're open to discussion, collaboration. And that is definitely something I'll be seeking to do, because I think he's right. There is a moment right now. And I think if Transform can step to leading that, as it were, not in the sense of being the boss, but as a leader, actually marching with the people for the collective good, then I think they could gain a lot of support in the grassroots community if they reach out to various stakeholders, as we sort of alluded to. So I do wish him and Transform the best. Yeah, I do apologise as well, folks. I've been off for a couple of weeks, as I alluded to at the start. Been very busy with Durham City Cannabis Club and sort of the Hemp Gardens project. Yeah, I've got Mendo Dub coming next week after. I don't know. I'm kind of lost as to what day we're on currently. But yeah, Mendo Dub will be jumping back in the hot seat. I'm waiting on my German guest to get back to me with the date as well. So hopefully that'll come to fruition before too long. There was somebody else, Dr. Callie Sieben as well. We were supposed to do a recording a couple of weeks ago. She's taken a bit of a step back for a minute from sort of some of her roles. So yeah, I'm going to let her recover and get into better health, and then hopefully we'll jump back in and do a recording about synthetics, about vaporization, and sort of, you know, the latest science, because I still believe that is a really important conversation. But yeah, we should be back with regular episodes from now on. Saying that, I am taking on another project, spreading myself very thin here, folks, but I do appreciate you still liking, sharing, interacting with the podcast while I have been away. It is greatly appreciated. I'm not going to keep you much longer because this has been nearly 3 hours. Quite a good introduction after reintroduction after a month off. So I'll let you get back to your lives, folks. Go enjoy your day. Go enjoy what... Yeah, it looks like summer's out there. Yeah, apparently. Enjoy what's left of the summer, and yeah, be good to each other, folks. If you really like this, please do give us a like, a share, a subscribe, a thumbs up, a rating, a heart, whatever it is on your platform, whatever platform it is that you're enjoying this podcast. To show your appreciation, I appreciate it and you. Check out simpalife.com for more articles. Check out Legacy Culture as well, a new media project me and Tyler Green are working on. Yeah, if you really enjoyed this, check us out on patreon.com/Simpa Life, where for less than a cup of coffee a month you can help me keep the lights on this little project. All right, you've been beautiful. Check out the links below for everything for Transform, and we'll be back next week with, I don't know, somebody. You'll love it. I'll love it. All right, peace and love, folks. Saying I said that I haven't been in this hot seat for 4 weeks because I've been doing other projects, so this could be interesting. Knock the cobwebs off and get started, shall we?